A very good morning to all. Good afternoon and good evening to all friends of CINI sitting across various time zones in various parts of the world. We have gathered here today for a very special occasion. I welcome you all at CINI's 48th Foundation 19, and with the stringent lockdown, we hope to take care of the situation. But as the years passed by and the onset of the second wave and the third waves, this year we observe our 48th Foundation Day online, and we hope to reach out to a much wider audience across the various time zones. I once again take opportunity to welcome you all and be a part of today's celebrations. In our program today, we share CINI's achievements in the year 2020-2021. We take a walk in CINI's intervention geographies across the eastern states of India, Assam, Jharkhand, Odisha, and West Bengal. We felicitate our CINI colleagues for their outstanding performance. During the day, we hear our friends across the globe, and we gather our thoughts around the panel discussion themed Educate to Protect, protecting children devastated by COVID-19 pandemic, the priorities and the way forward. May we now begin the program with an inaugural performance by the children of CINI Kolkata unit. Big round of applause for all the children. Isn't it a pleasure to watch the children dance? And after all, they are our biggest source of inspiration. Moving on, may I now request Professor Kollan Mondal, President of CINI's governing body, to deliver his welcome speech. Professor Kollan Mondal was a professor of sociology, Public Policy and Management at the Indian Institute of Management, Kolkata. He earned a PhD in Sociology from the Indian Institute of Technology, Mumbai, and has 25 years of experience in teaching at various institutions, including IIM Kolkata and Tata Institute of Social Sciences, Mumbai. Over to you, sir. I think, sir, you're on mute. If you kindly unmute yourself, sir.
Good morning and a very warm welcome to everyone who has joined us today. It gives me immense pleasure to see all of you gracing us with your presence on 48th Foundation Day of CINI. Once again, due to the pandemic situation, we are forced to celebrate the day online. This half-a-day event has been designed with various programs, which include a beautiful dance program by our children, which you have just seen, felicitation of eminent personalities, awarding CINI's Star Performers of the Year, take a walk into CINI's intervention across the states of Assam, Jharkhand, Odisha, and West Bengal, hear words from our friends across the globe, and most importantly, gather thoughts and future directions from eminent speakers in the panel discussion on Educate to Protect. I convey a warm welcome to Sri DILIP MONDAL, Minister of State, Department of Transport, Government of West Bengal, who has joined us as the chief guest. I feel extremely happy to welcome Srimati Ananya Chakravarti Chatterjee, Chairperson, West Bengal Commission for Protection of Child Rights. As the special guest, she will share her valuable thoughts on the child protection issues. I welcome Srimati Madhuri Bose, founder, Bose Legacy Foundation, United Kingdom, and Dr. Anita Seth from Johns Hopkins Bloomberg School of Public Health, USA, for gracing the occasion as special guests. I am happy that Sri Avijit Mitra, Special Secretary, Department of Women and Child Development and Social Welfare, Government of West Bengal, will share his thought in the panel discussion on how Government of West Bengal is saving lives of millions of girls by empowering them through Konyasri Prakalpo. I welcome other government dignitaries from all the states where CINI works. I welcome all the other eminent speakers of the panel discussion. They are Srimati Farida Lambay, co-founder Pratham, Srimati Rema Mohan, CEO NEC Foundation, Mr. Ranjan Kumar Mohanty, Chairperson, National Action and Coordination Group for Ending Violence Against Children, and Srimati Bharti Ali, Executive Director of HAQ Center for Child Rights. Representatives from various organizations like UNICEF, Save the Children, CRY, MacArthur Foundation, and partners organization, representatives from corporate bodies, our friends from various NGOs, and all well-wishers of CINI who have joined us today from various corners of the world. A warm welcome to all of them. I welcome friends from CINI international groups, Eliana and other team members from CINI Italy, Jenny and other team members from CINI Australia, Rosalind and others from CINI UK, Mark and other team members from CINI USA, and our new friend from Switzerland. I welcome my governing body members who are present with us today. Last but not least, I welcome my CINI team members, children, adolescents, and our community members, without whom we could not reach to the 48th year. Once again, a very warm welcome to all of you in today's auspicious occasion. Thank you.
Thank you, sir. Thank you once again. It gives me immense pleasure to introduce to you our Honorable Chief Guest, Sri DILIP MONDAL, Honorable Minister of State, Department of Transport, Government of West Bengal. Sri DILIP MONDAL is also CINI's next door neighbor and a long-term supporter of CINI. May I now request you, sir, to say a few words.
আমি দিলীপ মণ্ডল, রাষ্ট্রমন্ত্রী পরিবহন দপ্তর, পশ্চিমবঙ্গ সরকার। আজকের একটা বিশেষ দিন, সিনি চাইল্ড ইনস্টিটিউটের 48 ইয়ার্স সেলিব্রেশন ডে। এই দিনে আমি সবাইকে, সিনি পরিবার এবং সিনি যারা আছেন ডাইরেক্টর, অ্যাসিস্ট্যান্ট ডাইরেক্টর, সিনি পরিবারের সমস্ত সদস্যদের আমি শুভেচ্ছা, অভিনন্দন এবং ধন্যবাদ জানাই। দেখতে দেখতে সিনি 47 বছর পার হয়ে 48 বছরে তারা পদার্পণ করেছেন। এই 48 বছর দীর্ঘ একটা যাত্রা, দীর্ঘ একটা পথ অতিক্রম করতে বিভিন্ন বাধা বিঘ্ন, নানা রকম অসুবিধার মধ্যেও এই যে প্রায় অর্ধশত বছর প্রায় পদার্পণ করতে চলেছেন, এটা একটা অনেক মানুষের পরিশ্রম, অনেক মানুষের ত্যাগ, অনেক মানুষের সংগঠিত করার মধ্য দিয়ে, সংঘবদ্ধতার মধ্য দিয়েই এই যাত্রা অনেকটা আগিয়েছেন। এর জন্য আমি সমস্ত পরিবার এবং তাদের ডাইরেক্টর, পরিচালক ডক্টর সমীর নারায়ণ চৌধুরী মহাশয় সহ অন্যদেরকে আমি ধন্যবাদ এবং কৃতজ্ঞতা জানাই। সিনি ইতিমধ্যে ভারত সরকারের প্রায় দুটো যে পুরস্কার তারা পেয়েছেন, এটা তাদের একটা গর্বের, এবং তার সাথে আমি মনে করি আমি বিষ্ণুপুরবাসীর বিধায়ক হিসেবে এটা আমাদের একটা সম্মান, এটা আমাদের একটা গর্বের, এবং এই সম্মানের সাথে আমরা আগামী দিন যাতে এই সিনি আরো ভালো করে মানুষের কাছে পৌঁছায়, মানুষের সঙ্গে নিয়ে মানুষের অসুবিধার কথা বারংবার তারা বিভিন্নভাবে তারা পর্যালোচনা করে, তারা ফিল্ডে গিয়ে সমস্ত অসুবিধার কথা তারা বোঝার চেষ্টা করেন এবং সরকারকে অনেকটাই তারা সাহায্য করেন, সহযোগিতা করে দেন, যেটা একটা রাস্তা দেখিয়ে দেন। এটা আমাদের কাছে, পশ্চিমবঙ্গ সরকারের কাছে এটা একটা আলাদা সহযোগিতা, যে সহযোগিতা আগামী দিন আমাদের এই রাজ্য বিভিন্ন, বিশেষ করে শিশুদের ক্ষেত্রে, মা এবং শিশুদের তাদের বিভিন্ন অসুবিধার যে কথা সেগুলো আমরা জানতে পারছি, এবং এইগুলোকে নিয়েই আগামী দিন আমরা আমাদের সরকারের পক্ষ থেকে আমরা আশা করব সেই অসুবিধা দূর করে যাতে কিভাবে এই শিশুদের প্রোটেকশন দেওয়া যায়, শিশুদের ক্ষেত্রে বিভিন্ন শিক্ষার জায়গাটা আরো বেশি বেশি করে মানুষের কাছে পৌঁছে দেওয়া যায়। এবং এই শিক্ষার মধ্য দিয়ে আমরা মনে করি শিক্ষা এমন একটি বিষয় যেটা আমাদের জ্ঞান এবং পথ দেখিয়ে দেয়, এবং সেই শিক্ষায় বিশেষ করে করোনা কালে আমরা দেখেছি অনেক শিশুদের অসুবিধা হচ্ছে, তবুও আমাদের সরকার প্রচুর সংখ্যক ভ্যাকসিন দিয়েছেন, এবং বিশেষ করে 15 থেকে 17 বছরের শিশুদের টিকা দেওয়ার মধ্য দিয়ে অনেকটাই প্রোটেকশন তারা আমাদের সরকার নিয়েছেন, এবং যার কারণে স্কুল আগামী 3 ফেব্রুয়ারি 3রা ফেব্রুয়ারি থেকে চালু হবে, যেটা মানসিকভাবে শিশু এবং বিশেষ করে ছাত্রছাত্রীরা তারা উপকৃত হবে এবং আমাদের দেশের ভবিষ্যৎ গড়ে উঠবে। সিনি উত্তরোত্তর আরো মানুষের কাছে পৌঁছে, সারা দেশের কাছে পৌঁছে যাক, এই শুভকামনা করি, এবং তাদের যাত্রা আরো প্রশস্ত হোক, এই কথা বলে সবাইকে ধন্যবাদ জানিয়ে সিনির এই 48 বছরের তাদের যাত্রা সফল হবেই এই আশা রেখে সবাইকে ধন্যবাদ জানিয়ে আমার কথা আমি শেষ করছি। ধন্যবাদ।
A big round of applause. Thank you, sir, so very much for your kind words. Well, he went on to wish CINI for its journey across the 48 years and how CINI, since 1975, through its relentless efforts, had been working to secure the rights of children. Thank you once again, sir. Moving on, it is time to unveil our annual report. May I request Dr. Shomi Chaudhary, founder and secretary of CINI governing body and lovingly known to many of us as our dear Dr. Babu. I am requesting Dr. Chaudhary to release the annual report and say a few words.
It gives me great pleasure to have just unveiled the annual report of the Institute. Now, going ahead, I'm very happy to see the smiling faces of the children who are dancing and really enjoying themselves and giving us a flavor of what they feel in the field. Now, to start with our history about CINI, we are a non-profit organization and we have adopted the rights-based approach to programming with children and adolescents to foster human and social development. Now, where do we come from? We come from a spirit of serving the poor, and we started our journey in 1974. And many young people joined me, and some of them are with us today. We started with malnutrition because that was the earliest, the biggest killer. And then we also established how to prevent malnutrition in children and give them a healthy life. Now, what do we bring to the table? We are a learning organization. And in the scope of our work, we have kept our ears to the ground, learn from the needs of the people, and try to give back to them skills to go ahead and survive, and how to go ahead and be productive. So what is our vision? Our vision is to create a friendly and responsible community where children and adolescents achieve their full potential. And this leads to the development of our mission to ensure that children and adolescents achieve their right to health, nutrition, education, protection, and participation by making duty bearers and communities responsive to their well-being. What is our reach? Our reach has now extended, just like all mighty rivers start very humbly with a small trickle. We have now grown to be a force which is now serving the 4 states of West Bengal, Jharkhand, Odisha, and Assam. We have almost 1,400 dedicated professionals who work with local communities, and we cover 10 million people across the states. How do we do our work? We are supported by the CINI international groups located in UK, USA, and Australia. But more important, we are also supported by poor people in our own country, by our own government, by local communities, by corporates, by international and national trusts and foundations. Now, how have we achieved our milestones? We kept our focus on the ground, and I think most importantly, we have kept our focus on adolescents, because that is where anything and everything happens. And through this focus, we have nurtured a girl from the pavements of Calcutta, Ishika, who has spoken at an international forum. She addressed the 45th regular session of the Human Rights Council. She addressed the issues faced by street-connected children and stated, "I'm urging world leaders to come up with solutions so that we can access food, healthcare, and shelter for anywhere in my country." Now, we want all our adolescents to achieve that level of commitment, liberation, and confidence so they can grow up to be productive adults. We also went through COVID, and the last 2 years has seen us reach out to the people who are shocked, who were not hopeful, and we stood by them, giving them hope. We have served 150,000 people, families, with supplementary nutrition, hygiene kits, and with mix. And we could not have done this without the support of CINCOM, who have been with us all along. Now, as we work through, we have set up COVID Shahata Kendras, safe homes, and we have engaged with government health workers, spreading our message of hope, helping them to get vaccinated and reaching the unreached in all these 4 states. We also have reached vulnerable children who live on the pavements. We kept our centers open to serve those who need our services during this pandemic. And in the end, due to our skills of working with children, we felt it's very important to dirty our fingers, and we have opened up Cyril Academy, a school for disadvantaged children. So I think we are very grateful that we have been supported all along in our journey. And how do we see our way ahead? We see that we will promote this to the CINI method, which is a horizontal program of convergence and not a vertical program, where we work with local communities and with systems and organizations to make ourselves more child-friendly. And in this COVID situation, we will prioritize our interventions in child education and protection, because we have lost a whole generation due to the school closure. And I think protection and education are 2 vulnerable areas. And there's a seminar at the end of this session, which will discuss these issues, and we'll seek guidance from experts. We will use digital medium, as we are using it now, to reach the unreached and to reach all these 10 million people in all the far corners of Eastern India. We will emphasize and will concentrate on non-communicable diseases, because we have seen malnutrition of a different sort, obesity, which is now is very commonly seen even in the slums and in the villages. We will also take up the climate change issues, because this generation cannot wait and will blame us because we have used up all the Earth's resources too fast. So this is an area where we'll focus our attention. And finally, through our Look-East policy, we will focus on the Northeast and Northeastern states, because they have been neglected too long. And this is our mission. So this time, we have been able to do this journey because we have been supported by the panchayat, the communities around us, our own government, and also our corporate friends have come forward with their CSR support to help us go the way. And last but not the least, the international support groups based in UK, Italy, Australia, and also USA, who have been with us all along to allow us to continue this journey. So thank you very much, and I'm very grateful to all of you. Namaskar.
Thank you, Dr. Chaudhary, for unveiling the annual report and for your kind words. It is always encouraging to hear you speak. Moving on, CINI's Look East policy prioritizes our work across the eastern states of India, which are Odisha, Jharkhand, West Bengal, and Assam. So let's go and visit the places. Well, It's time to say Johar or Namaste. That is how they lovingly greet people from the land of the forests, Jharkhand, an eastern state in India where CINI works. Let's go over to Jharkhand.
Jharkhand, the land of forest, remains the home to several tribal communities, already battling with poor development indicators and communities migrating due to lack of opportunities. The situation was worsened by the brunt of the pandemic.
In this highly volatile environment, the body of work that CINI did could be categorized into three groups: preventive communication campaign and treatment facilitation, emergency response to reduce the impact of the pandemic, and facilitation of the regular EPHN services which were highly disrupted due to the pandemic.
CINI realized that in the two areas where the community needs support to fight the pandemic are access to information and access to health services. The COVID Sahayata Kendra or CSK and the Jagrukta Rath, run with the support of the district administration, served as a game changer in this direction.
हम लोग काफी थैंकफुल हैं कि उन्होंने एक यहाँ पर CINI कोविड सहायता केंद्र शुरू किया है और ये हमारे डेडिकेटेड कोविड हॉस्पिटल के बिल्कुल पास में है, साथ ही साथ डिस्ट्रिक्ट कंट्रोल रूम के भी पास है, तो इंटीग्रेटेड वे में काफी लोगों को इससे फायदा होगा.
The services offered through the COVID Sahayata Kendra has evolved over a period of time. One of the most promising interventions through the CSK platform has been the academic support to children during school closure. These village-level learning centers run through community-led approach are engaging local educated youths as learning facilitators. To ensure continued engagement with children and early identification of such risk, even during restrictive mobility of our team, CINI has effectively used the digital platform to reach out to children and engage with them creatively. Mobile-based applications like the COVID Orphan Tracking app, the Yuva Chetna app, helped in evidence-based decision-making on identification of children at risk and expedite case management through the government child protection system. The compulsion of keeping the physical safe spaces closed due to the COVID restrictions give birth to the concept of virtual safe spaces. The innovation of the virtual safe spaces to continue the meaningful and creative engagement with adolescents got an amazing response from the children as well as their parents. When the health system was overwhelmed in managing COVID, then the intervention to go to the household level, track the dropout and left out in the routine immunization services and link them back to the system was a simple yet an effective way of saving lives of children. Since the advent of the pandemic in the state, CINI in Jharkhand has supported around 9,000 families with nutrition basket as an emergency relief to address food security arising out of livelihood losses. The year has been a roller coaster ride where we have left no stone unturned in transforming every challenge into a new opportunity. All the frustration, fear, and failures has made us learn new ways of doing things and still achieving CINI's mission and vision of creating a child-friendly space within the communities. The pandemic is still knocking at our door every day and hope we can keep the smiles intact on the faces of the communities for whom we are committed to work for the decades to come.
Congratulations, CINI and 48.
Thank you, Shumantro, and all the team members for the presentation. Well, due to the technical glitch, there was an issue where we were unable to share a few important messages and a little information about the governing body. So requesting our team members to kindly put on that part now. And also requesting Dr. Chaudhary once again to kindly come up and share the details which we had missed due to the technical glitch. And there we can see him on the screen, and I'm sure it's going to work out this time. We can very faintly hear Dr. Chaudhary's voice. So once again, requesting the team members to please take care of the situation.
And finally, Mr. Dibyendu Bose, who joined us recently from the corporate sector. So we are all grateful to you for giving us guidance and help over the past few decades.
Well, I think he's already read out the names of our respected governing body members. I'm sure my team members out there can hear me. Okay, so, well, so can we move on to the next? Okay, so we visited one of the states, one of the eastern states in India. Well, we are again back on screen, and we have the photograph of our respected governing body member, Mr. Amit Dashgupta. So, well, team members, going back to the course of the day, we visited Jharkhand, one of the eastern states where CINI works. So let us move on to the next. So, Namaskara Kimiti Achanti, which means greetings and how are you all from the land of heritage temples and coasts. You must have guessed by now. Well, it is Odisha, one of the other eastern states where CINI works. Let's go over to Odisha now.
Namaskar to all the honorable guests across the world and to all the members of CINI family. I am Sashwati Naik Mahapatra, State Program Manager Odisha. On behalf of my team, I would like to congratulate each and every one of you on the auspicious occasion of 48 years Foundation Day of CINI.
Odisha is one of the states of India in which there is significant reduction of undernutrition with optimal infant young child feeding practices.
CINI has started its intervention in Odisha
Since 2016.
GFATM and Plan India, CINI is implementing a HANA project in 30 districts of Odisha in order to prevent parent-to-child transmission of HIV. With the support of UNICEF, CINIs provide technical support to improve the IOI practices in 23 districts of Odisha. Similarly, in order to provide the doorstep care to pregnant lactating mothers, adolescent girls, and to spread awareness on non-communicable diseases, CINI is implementing a project with the support of Industry Bank in Bisam Katak block of Rayagada district. CINI has established COVID Sahayata Kendra in order to address the issues, different issues during the COVID situation. With this program, CINI is reaching the most vulnerable populations of Odisha, and CINI is very much ambitious and hopeful to spread its programs in coming years in different other parts of Odisha and to reach the most vulnerable populations of Odisha.
ମୋ ନାଁ ରାମାରାଓ କାମ୍ବାକା ଗ୍ରାମ ସାହାଡ଼ା ମୁଁ ଜଣେ ଚାଷୀ ଏବଂ ମୋର ପିଲା ଜଣ ଅଛି 1.5 ବର୍ଷର ଛୁଆ ତାକୁ ଅପପୁଷ୍ଟିର ଶିକାର ହେଇଥିଲା ସେହି ସମୟରେ ଆମର ସିନି କର୍ମୀ ମାନେ ଆସି ଏକ ଅପୁଷ୍ଟିସାର ବିହନ ଯୋଗେଇ ଦେଇଥିଲେ ଏବଂ ବଗିଚାରେ ମୁଁ କରିଥିଲି ଚାଷ ଆଉ ଭଲ ଲାଭବାନ ହେଇଥିଲା
Thank you, Shashwati and team members, for this presentation. Moving on, let's visit another eastern state of India. Well, Hokkolukalai Namaskaro. This is how they greet people in the sweetest way in the land of Assam. Well, the doorway to the northeast and the land of the Brahmaputra River. It is yet another eastern state where CINI works. Let's go over to Assam.
CINI Assam Unit of সকলোকে নমস্কাৰ দিছো আকৌ আৰু নৱবৰ্ষৰ শুভেচ্ছা থাকিল সকলোকে মোৰ নাম প্ৰতীক্ষা বৰা আৰু মই অসম ইউনিটৰ লগত জড়িত CINI Assam has started its journey in 2018 with the two aspirational districts, that is Gwalpara and Dhubri. And within a span of 3 years, we are now covering 11 districts out of 33 districts. Assam is a land of many tribal groups and a diverse culture and tradition present there. CINI through its democratic CINI method and a right-based perspective, we are trying to address the social issues of all the diverse cultural and tribal groups of Assam. Even during the pandemic and the lockdown, CINI Assam were in the forefront in helping the government through this helpline, even during the first wave and the second wave, and also in the third wave of the COVID. With the objective and with the hope of reaching out to the many communities and building the resilience of the community, we will try to expand as many geographical areas as possible. And with this, I would like to thank everyone and also wish to stay healthy. Thank you.
Thank you, Pritisha and team, for the amazing work. Moving on, as all of you know that the Bose Legacy Foundation is the legacy of none other than the great Subhash Chandra Bose. Today, we have the proud privilege of having Srimati Madhuri Bose, eminent writer and educationist from Kolkata amongst us as the special guest from the Bose Legacy Foundation. Requesting ma'am to share a few words.
Good morning and warm greetings from myself and the Bose Legacy Foundation to Dr. Shomi Chaudhary, our dear Dr. Babu, and esteemed management and field workers of CINI. I'm both delighted and honored to be invited to speak as a special guest at this 48th annual day celebration of CINI. I'm especially happy that your theme for today is Educate to Protect. I speak here today as the founder and trustee of the Bose Legacy Foundation. Bose Legacy Foundation was set up in 2018 to promote the vision for New India of Sharat Chandra Bose, the elder brother of Subhash Chandra Bose, and Subhash Chandra Bose. They both shared a common vision of the new India they dreamed of. So, and one of its principal objectives is to support and provide education to all, particularly to children of India who, for various reasons, cannot access education. I must tell you here that education for all was a central principle of the Bose brothers in their vision for New India. In fact, Subhash Chandra Bose, as the president of the Congress, Indian National Congress, in 1938, spelled out what he thought was going to be of fundamental importance to free and united India, and a principal objective in that charter was education for all. Now to share our journey with CINI to support education for the girl child. We began our cooperation about 3 years ago, and Bose Legacy has given a number of scholarships to girl students in the care of CINI to complete their secondary education. Last December, I, and together with another trustee of Bose Legacy Foundation, Dr. Vivek Bose, and my young niece, Aparajita, together with the foot soldiers of CINI, Kakoli and Choitali, we went to visit some of the girls who had received the Bose Legacy scholarships. And I must say, it was an amazing experience. We went along the Diamond Harbor Road and reached a village where we walked in and found a completely destroyed hut. And that's where the CINI scholarship holder of Bose Legacy Foundation lived. Since the cyclone had destroyed their home, they had moved next door to their grandmother's home. That was also a very small hut, but that's where the girls came and we met them, and we were just at a loss for words. They were bright, animated. They told us about their ambitions. They wanted to be doctors, teachers, and even soldiers. So it was just overwhelming to talk to them. And at my request, they even sang a Rabindra Sangit song. So today, on this very special occasion, let me wish the CINI family all the very best in their endeavors to make the children of India educated, healthy, and happy. Thank you.
Thank you, ma'am, for all the best wishes. Thank you very much. Moving on. It gives me great privilege to announce the presence of Dr. Anita Seth as a special guest, Director of Child Health, International Vaccine Access Center, Johns Hopkins Bloomberg School of Public Health, amongst us today online, all the way from Baltimore, USA. Welcome, ma'am. Requesting ma'am to share a few words.
Thank you so much. It really is such an immense privilege to be on this panel and speak at the 40th Annual Day celebration of the Child in Need Institute. The CINI, as you have heard multiple times, is a quiet force that has been transforming lives for the past 5 decades. What we don't often think about is how working with or within CINI has also transformed the lives of the workers and the partners and the people themselves. And the lines from Rabindranath Tagore come to my mind. He said, "I slept and dreamt that life was joy. I awoke and saw that life was service, and I acted, and behold, service was joy." So it is sheer joy just to be in the company of those at CINI. The child-centric and the child-friendly approach that CINI has adopted is not only unique, but it is central to the transformation that is unfolding before our eyes. As you just heard the vignette and all the previous stories. From Johns Hopkins, our team at the Maternal and Child Health Center India has been working with the CINI team on basic health needs of the child, immunization and nutrition. We know how much the pandemic has disrupted our daily lives, and we know we cannot sit by and watch the basic needs of children and families go unfulfilled. But CINI has been living with these relief activities day and night. And there is something special that makes their activities actually effective. So let's take the story of immunization. Now, we often lose sight of this, but we know that vaccines is one of the greatest public health tools from the past century. Vaccine preventable deaths used to be the biggest cause of death and suffering not so long ago. But sadly, the recent work with the World Health Organization and other agencies have indicated that in 2020 alone, about 8 million children missed out on their routine vaccines. And about 1/4 of those children live in India. And governments and agencies everywhere are working hard to address this problem. And if we simplify the approach, there are some fundamental elements we can consider with respect to immunization. Now, traditionally, we know we need 3 things: the vaccine, the vaccinator, and the child. However, we are realizing more and more that there are these concentric circles around these 3 elements that are absolutely necessary if we need to fill the gaps. And these social determinants of health are critical. And that is exactly why CINI is so ahead of the game here. The CINI method that you have been hearing about and that we have been actually learning about is unique as a model that brings together child-friendly communities, child-friendly systems, and child-friendly organizations. The child is really at the center of this approach, and CINI works very closely with the communities and the government. And this approach tackles the issues from a human rights perspective. And I have seen how children who have benefited from this approach have grown up and have become part of CINI. They're adults now and continue giving back to society. So our team at Johns Hopkins is enriched by this collaboration with CINI. And this humanitarian work by CINI extends to every aspect of what they do. Dr. Samir is not only a visionary, but one who exudes kindness, which rubs off on everyone who is in contact with him. And in the work that we are doing with CINI, I'm often reminded of the concept from the Maha Upanishads of how closely we are all connected. Vasudhaiva Kutumbakam, the world is one family. Its meaning imparts the sense of oneness to our common humanity, our common development goals, and our common quest for happiness and peace. And CINI embodies this goal, and we are really honored to be part of this family. And on behalf of all my colleagues at Johns Hopkins School of Public Health, I thank the leaders of CINI and the members and all the staff and collaborators, friends, families, and communities that are served by CINI. Thank you very much.
Thank you, ma'am. Thank you, ma'am, for your inspiring words. And also for supporting CINI. Well, we will wait and to recognize our CINI colleagues for their outstanding performance in 2020-2021. It will be amazing to listen to the number of people and the number of family members we have. Well, 1395, that is the number of the entire CINI family. Choosing a few outstanding performers amongst them is a very tough job indeed. All their efforts are much, much appreciated. All of them are stars. But this year, we have decided to felicitate a few of them for their outstanding performance during 2020-2021. It is a proud moment to present the names of the winners. Gauramuni Tuti from CINI Jharkhand has been associated with CINI for more than 1 decade and is the champion of community-led approach on child protection. A big round of applause for her. As you can see, that her struggles and perseverance in working with communities has really been appreciated, both not only within the organization, but also at the community at large. Can we have the next winner, please? Well, there we have Idris Ali from CINI Murshidabad unit. He started his journey from 8 March 2004 and till date continues to be a very sincere and committed staff. His profound knowledge and application of knowledge in field is amazing. His communication skills are very good and he qualifies to be a very good trainer and thus is a deserving candidate. A big round of applause for Mr. Idris Ali. Can we have the next winner, please? There we go. Well, Mr. Jayant Rai from North Dinajpur unit, CINI West Bengal, at the age of 18 years got attached with CINI as an adolescent volunteer in Link Worker Scheme since 2010. In 2012, he joined CINI as a volunteer of the Childline project, and with the time, he proved himself with his dedicated work and was promoted as a team member of Childline in 2019. Another round of applause for Mr. Jayant Roy. Our next winner, please. Can we have the nameplate of the next winner, please? Yes. Where? There we have Mr. Pulokesh Khatua, who is one of the exemplary members associated with CINI community initiatives since the year 2016. He manages as the position in the production and delivery and is one of the forerunners in CINI running the production and packaging units. Congratulations, Pulokesh. Can we have the next winner? Yes, there we have. Miss Shampunna Roy from CINI head office has completed 10 years in CINI and proved to be a very hardworking, efficient and a responsible employee. Currently working as a project coordinator in the SAC KP program. Congratulations, Shampunna. May we have the next winner? Just bear with us, it's another little technical glitch. Requesting team, can we have the next winner, please? Yes. Okay. This year, we have a special award in this category, the CEO's Choice. We are proud to present this year's CEO's Choice Award to our beloved colleague, Sri Shantan Saran. Shantan started his journey with CINI in 2007 as Senior Program Associate Accounts in our CINI Jharkhand unit. Over the years, he has shown tremendous growth in understanding the CINI way and achieving optimal levels of performance. He always shows a sincere interest in colleagues and offers solutions to their problems. Here is to Shantan Saran, now Program Manager Accounts, a dependable friend and a meaningful contributor to CINI's family in Jharkhand. May we have the name of the next winner, please?
That keeps falling. This bag keeps falling. That is not.
We're all waiting to hear the name of the next winner.
I still have it on.
You know what it's like now? It's finished.
Well, I won't keep you all waiting, but give you the name. Requesting our team members, if the slide of the next winner can be shown. Timir Kollan from Diamond Harbour unit began his career as a CINI Childline volunteer in 2006. Before his professional career, he was a peer leader in CINI. His contribution to CINI's response to COVID-19 has been exemplary. Congratulations to all our CINI colleagues for their outstanding performance and a big round of applause to all.
They made that mistake, so I corrected it in my presentation. It's a most legacy named after him.
Moving on. Cholelam Banglar Matite. As we set foot in West Bengal, the only eastern state in India which shares the largest international border with Bhutan, Bangladesh, and Nepal, the land of the river Ganges, and is also the state from where CINI had begun its journey. Let's go over to West Bengal.
Dear friends and colleagues, often from CINI, who have joined us on this day, let me wish you a very good morning while I introduce to you the oldest state chapter of CINI, the West Bengal chapter. Today, if we look into the state chapter of West Bengal, we have 5 large district-based units which cater for not only the districts where they are situated, but also some of the adjacent districts. Let me introduce them one by one. We start with our South 24 Parganas unit, which we call our Diamond Harbour unit, which is situated in the interior heart of South 24 Parganas. Sri Ashutosh Mollik, with his team of professionals who have joined us today, heads the South 24 Parganas of the Diamond Harbour unit of CINI.
This is Ashutosh Mollik, looking after the Diamond Harbour unit of CINI with active support from my colleagues. South 24 Parganas is one of the most vulnerable districts of West Bengal, where the unit was established in 1998 with a health and nutrition program in just one block. Now the unit is covering 15 blocks of the district through education, child protection, health and nutrition programs. The unit is also managing SEC-KB convergence program in 4 other districts, namely Howrah, Hubli, East Medicine and West Bardhaman.
CINI's urban unit, known as Kolkata Urban Unit, situated in the heart of the city of Kolkata, has one of the largest child protection programs of the institute. Dr. Shati Chakraborty and her team leads Kolkata Urban Unit today and carries forward the vision of the institute in the urban programming of the organization.
CINI is working with the most vulnerable populations who are living on the slums, streets, and different vulnerable pockets in the city of Kolkata.
CINI is customizing its right-based practices for the urban context in line with SDGs. CINI is working towards ensuring the right to survival, development, protection, participation for all children, especially the most vulnerable children and children living with deafness in urban context. CINI has worked on 1,000 days approach with vulnerable communities and worked with health centers to ensure routine immunization, antenatal checkups, postnatal checkups, and other MCH services.
Kolkata unit also runs 2 of the largest childcare institutions in the city at Amader Bari and Hamara Ghar, one for the girls, the other for the boys. Next comes our Murshidabad unit. As you know, Murshidabad is one of the largest and the most backward districts of the state, comprising of 26 blocks and extremely poor population, shares one of the largest boundaries, international boundaries with Bangladesh. Murshidabad unit today has become one of the largest field units of West Bengal, experimenting with what we have distilled and documented for all these 48 years, what we call CINI method. Murshidabad unit is the laboratory of CINI method, where we work with the system, engage with the community institutions, involve the government, and run our programs. Mr. Jayanta Chaudhary and his team heads the Murshidabad unit for us, who have joined us today as well.
Hello everyone, I am Jayanta Chaudhary, unit in charge of CINI Murshidabad unit. Due to closure of school, children have become more vulnerable with multiple vulnerabilities like child labor, early marriage, substance misuse, trafficking, etc. We started our intervention with education. We have been able to reach out 5,000 children with our doorstep education services, commonly known as Duare Shikha, by involving SHG women in the community and adolescent girls. Apart from this, around 1,000 children belong to class 9 and 10.
Quickly requesting once again the team members, there has been a technical glitch and we are unable to see the video.
The next comes Uttar Dinajpur unit. Uttar Dinajpur, though a small district, is very distinct in nature, in the sense the district is absolutely divided into 2 subdivisions of very different demographies of Islampur and Raiganj. Our unit, headed by Sri Sushobhan Das and his team.
Warm greetings from Uttar Dinajpur unit, CINI. We have started our journey in this district in 2008 with its overreaching aims to create a friendly and responsive community where children and adolescents achieve their full potentials. We have established our presence at all 9 blocks of the district, either through direct involvement.
Please bear with us. There continues to be a technical glitch, and requesting our team members to kindly take care of it and show the video, please.
Uttar Dinajpur unit has also run very important child protection programs and programs that has led the vision of the institute in building child-friendly communities. Last but not the least is our North Bengal unit housed in Siliguri. Sri Ratan Lama and his team heads the North Bengal unit.
This is Ratan Lama, Unit Coordinator Child in Need Institute North Bengal Unit, looking after our program in Coach Bihar, Jalpaiguri, Darjeeling, Kalimpong, and Alipurduar. The unit has 23 programs, 7 under the theme of education, 5 under health and nutrition, 4 under protection, and 7 under adolescence. The unit has so far reached all the project field in spite of the COVID restrictions that has been in place since 2020. The unit would like to thank the government, the community, and the staff for helping them reach the children in need in these difficult hours.
As you know, North Bengal districts are also plagued with tea gardens and a different kind of poverty, vulnerability, and other issues that have marked very distinct in nature for the entire state. So Ratan and his team give supports to these communities through their child protection programs. Ratan also has some of the largest child protection programs of the institute in housing, an open shelter, a home for the girls, railway child line in NJP station, and a Siliguri child line, Darjeeling child line, and also some of the deepest programs in some of the deepest tea garden pockets of the district. With my colleagues in the headquarters and the units, the district units, I welcome you all. I would also like to add to this discussion that in the last 2 years of the pandemic, CINI has also worked extensively in COVID, in responding to the pandemic, where we have donated medical equipments, pulmonary medical equipments to the public health system, to the BPHCs, to the rural hospitals, to the medical college and hospitals, to the district hospitals, where we have run 4 safe homes. The safe homes were run by the units that I have just introduced you to. The Diamond Harbour unit, the Murshidabad unit, the Siliguri unit, they have run 4 safe homes for the COVID positive patients. We have run very grounded and community-based programs, making the community and the community institutions like the adolescent boys, the adolescent groups, the self-help groups, the frontline workers resilient to COVID. With the COVID programs, we have, in the last 2 years, we have reached to more than 1.5 lakhs, 150,000 families with food relief, where we have supplemented and complemented the government food relief programs. With my colleagues, as I said, with my colleagues in the units, in the districts, in West Bengal and the headquarters, I welcome you all to the 48th Foundation Day of CINI.
Thank you, Marine. Thank you so very much, and all the unit heads of West Bengal for the inspiring work. Moving on. Capacity building constitutes a key domain of CINI's work. Since 1975, CINI Training Unit specializes in imparting training to the government and non-government functionaries as one of the pioneering training institutes in India. The training center trains the frontline workers of the government across the health and nutrition, education, and protection thematic areas. Can we have the AV, please?
We welcome you all at CINI's 48th Foundation Day. I am Mithun Bush, representing the training unit of CINI. It started with own staff training to reach community through ripple effect and gradually grew up as one of the leading training institutes in India. It is the State Training Center of West Bengal under ASHA program and recognized as State Accredited Vocational Institute of NIUS. We start with training need assessment, accordingly designing of training module, manual, IEC, BCC materials, and conduction of training sessions, and finally evaluation of training courses, even handholding support to the grassroots level. The institute follows the participatory training method following adult learning principles. The training campus is surrounded by natural greens and has the capacity to accommodate 170 participants at a time. The Civil Academy School is our new initiative emphasizing on value-based education. Thank you.
Thank you. Thank you, Ms. Mithun Bosch and team. We now enter the most awaited part of the program, which is the panel discussion themed Educate to Protect, Protecting Children Devastated by COVID-19 Pandemic. May I now introduce you to Srimati Sulagna Roy, member of CINI's governing body, who had started her career in CINI in 1989 and has worked as an education specialist and child protection specialist in UNICEF. I invite you, ma'am, to moderate the session and take the lead henceforth.
Thank you. Thank you. Thank you, CINI, for giving me this opportunity to be able to talk to all of you about a subject that is very close to my heart, which is educate to protect. And I'm also humbled that I'm moderating a session with such eminent panelists with such a large volume of their knowledge and experience of their work. And it is really gives us we look forward with a lot of anticipation to the discussion that's going to follow. Now, coming to the subject, as you know, the media is now full talking about please open the school, because people have realized that closing schools has created situations of children back in their lives. For an example, if I look at in 2005, there was a earthquake in Pakistan and schools were closed for 14 months. And when they did a study after that, I think which was done by UNICEF, it was found that children had gone back 2 years in their learning. If this can happen in 14 months, just think what has happened to the children of India when they have missed school for 2 full years. UNICEF had done a rapid assessment and they realized that 40% access to digital have lost of concern, loss.
We can't hear Sulagna.
So I was talking about ADB, and ADB has in their study they have shown that this learning loss is a big loss of about 1.25 if you can do it in financial $1 million, which is a big amount. World Bank is talking about that every year of schooling loss brings about 9% lower the child's ability to earn in future. So overall, this just shows that we are in a situation where it is red emergency and things have to be done. And we know as the fallout of education, children are into child labor, they are getting married early, and child trafficking, because school is one safe place that one can keep. Now I come back closer to home, and CINI has done their own survey, and they found that 30% of the urban children and 7% of the rural children only had access to digital device. And below 10 years, the digital learning was ineffective because you need the connection with the teachers, with the parents, with the other peer group. And they run Childline Services, which is the National Childline Service, in which it is, in their data, they found that 8.7 percentage points increase in child marriage, 2.8% points in child labor, and child abuse has also gone up by 8.9%. So you know what, this is really a big concern for us. And we know the other issues, mental health issues, skill development like leadership, group work. None of this is actually working when the child is at home and is learning. So with this background, we have organized this panel discussion. CINI has organized this panel discussion. I've just been invited as a moderator. And we look forward to listening to the eminent speakers. The order of the presentation is based on thematically. And we have started this program. We are starting this discussion with Eliana, Dr. Eliana Riggio. She's an insider outsider because she was a long time in UNICEF, but she's also at present she's the chair of CINI International. She's an advisor to the governing body of CINI and CINI Resource. And she is going to, we are requesting her, or we are hoping that with her, she will set up the tone of the discussion. And that will help us to take the discussion forward. Talking about Eliana, sorry, I keep calling her Eliana and forget to call her Dr. Riggio because I've known her for umpteen years. She's a development planner, primarily working in UNICEF. She worked in UNICEF Calcutta, that's where I met her. Urban poverty, local governance, child protection, child rights are her focus. Policy development and research she's contributed to policy development and research in many countries. She was responsible for the International Child-Friendly Cities Secretariat being set up for realizing child rights. In India, for over 3 decades, she's contributing to child-friendly communities, and internationally, her contribution to research and policy analysis on sexual exploitation of children is very well known. She is going to speak about how COVID-19 has impacted child protection and education and strategies to be followed. I have just 2 things to say before I forward to Eliana, requesting all the panelists to keep their time between 10 to 12 minutes. And after 3 presentations, we'll open it for discussion. And then again, we'll have the 3 presentations. But in the meantime, the audience over here can go into chat, and if they have a question for a particular panelist, please mention it. And I'm requesting the panelists to look at that and answer it there as well as in the open session. Over to Eliana.
Thank you, Sulagna. Yes, you're right. I'm in and out of CINI at the same time, and I'm delighted today to be here with you. It allows me to remember all the work we have been able to do together in Calcutta for so many years. So thank you for introducing the panel, and I believe my task is also to continue breaking the ice for the panel and getting us more into the discussion we have today. So to start with, I'm going back a bit memory lane, and I take you back to 1971, when a very important book came out. I don't know if you remember, it was a classic in our field, The Schooling Society. Ivan Illich, the great visionary development thinker of our times, a book that really upset the entire environmental sector. His basic argument was so simple, so commonsensical. He basically said education, a primary need of a child, we would say today a fundamental right, which caters to so many different groups of children. Well, that specific need and right is addressed in the same way for different groups, normally through a single vertical centralized response, schooling, one single response. Illich had foreseen with great anticipation and wisdom, we realize now, that education for all through schooling alone is unattainable. And 50 years down the line, we know that the same, we can say, education ideology and the same model still persist. And sadly enough, education for all remains for us today still an elusive goal. So broadly at the same time, in 1974, 40 years today, that's why we are here today, the vision CINI was founded. And the vision of his founding father, Dr. Chaudhary is here with us today, we introduced the day. The vision he had for health for all, in his case, as a pediatrician, was very much in that Alma Ata Declaration spirit of a few years later, when, at the time when he wanted to go out and ensure that the most deprived groups got their right to health satisfied, he did not build a hospital. He did not build another vertical centralized institution. He went out to the communities where the poor live and reached out to them through preventive approaches, working with the community to keep people healthy before being in a situation of having to address diseases. That has been the spirit from the beginning, a rights-based approach to development. A few years later, not many years later, that is when Sulagna Roy and myself met, CINI moved into education. And CINI has been in education and in child protection from the late 80s. And at that point, still true to themselves, they did not build a school. What CINI did, moved out to the communities where those children who are enriched by schooling, by institutional educations live, and they started teaching. And that is the space where we have seen CINI for the last decades, so many decades of their work in education. It is a very, I would call it a no man's land between the street and the school. That is the space where people normally don't go. When they go, they just provide informal education. But CINI didn't do that. They used formal education to mainstream children into society. For CINI, education became the highway to child protection and to mainstreaming of children who are being kept out of the mainstream. A very special space, and that's where we have seen the learning centers of CINI just mushrooming across different contexts. You have seen them on the Cialda railway platforms. That's where we started. That's where UNICEF started in 1989, supporting CINI when Sulagna Roy was in charge of that program. Then you will find CINI in red light areas. You will find them in slums, in villages, all the way up in tribal communities, in the tea gardens of Darjeeling, all over the place. Wherever children are out of schools, you find CINI teaching. So you can say CINI work at the margins. Well, what COVID has done to us over the last just couple of years, it has been to reverse our own understanding of the world, the way we have known it so far. It has been a sort of a Copernican revolution of what we knew of ourselves, even in our development sector. Now, what we have is that the well-to-do, the middle-class children are out to school. And this is not in India, this is across the world. What was mainstream before now is out of stream, we could say. The lockdowns have resulted in locking out children from school. As Jean Dries, the famous economist, just analyzed when he wrote about the drama of education in India at the times of COVID. And what is worse, disregarding the warnings coming from authors and scientists and practitioners, we don't have a plan B. So this is the situation ahead of us. I just landed from Europe a few days back on one of these bubble flights. I'm very happy to be here in India today, to be able to celebrate 48 years of CINI. The situations I'm coming from, you know very well, is not much better than what is going on here or anywhere else in the world. Zooming back to education and protection, the global scenario is shocking. We have about 250 million children out of school today. This is UNICEF data, so we can take it as conservative. We have a huge learning loss. And we are told, well, we'll manage through technology, we manage through learning materials. But learning materials are made for classrooms. They are not made to teach people outside of the school. And also, they are not available. They don't reach children in India. The technological answer has to come to terms with a massive digital divide, which sacrifices the same children who were not reached before. This is resulting in more child labor. This is resulting in more child marriage. We have an estimate of 150 million being pushed into child labor now as a result of COVID. We have 10 million girls having higher risk of ending up in child marriage, in early marriage. And we know very well, a huge portion of them, the majority of them, are exactly in this country, India. We have a staggering 1 billion, not million, children estimated to be at risk of violence, abuse, and exploitation as the economic and social situation is deteriorating as a result of the pandemics. So the figures ahead of us are stunning. When I look at the Indian figures, they just show the tip of the iceberg. We can take a big chunk of these huge numbers, and we know already they will belong to this country, which is not a country, it's a continent, of course. So children have been already for 2 years out of school. How long more can we go? The pandemic is not over. Are we going 1 more year? Are we going 2 more years? And even if we get out of COVID, and we hope we will, and we hope we will soon, we know very well what the forecasting for the future is. The future of the world is emergencies. Crisis is going to be our new normality. So the brain of children are wiring. We can't wait for the world we had before to come back and put them back in the same education system we had before. The whole world is concentrated on the emergency, and that's important, that's necessary. But what is not being addressed properly is the education emergency, which is growing in parallel to that. In a situation where less attention, less investment, and less political will is being given to the education and protection of children. So I think time has come, and we can't wait any longer to take a very hard look at that problem. So what CINI has done in this situation? Well, CINI has just had the model ready. CINI has been working exactly out of school and exactly with children who have no access to school for the last 30, almost 40 years now, 35 odd years. The first thing they did, they ran what CINI has done. They were already in the communities, they were already working with children and mothers. They ran a rapid survey. Now 9,000 kids reached out overnight. And what came out was shocking. Only 30% of kids in urban areas, including Metro, mind you, had access to technology or to internet. And in the rural areas of Bengal, 7%. That means kids are not simply out of technology. They estimated that out of 9,000 kids, that's a good sample, that the learning loss that Sulagna Roy just spoke to us about was almost 70%. So we had lost completely our ground. The battle was already lost. So what CINI did on day one of lockdown, they were already there. They just developed more of the learning centers, which started mushrooming all over their large land where they are working. And they reach out to the community, but at the very, very local level. They set them up at the hamlet level, not at the village level, below, at the hamlet, below trees, in the courtyards of houses, in the premises of schools that are now abandoned shells without children around anymore. They started running their own education programs. And what did they do? They had a model ready. They have a model which doesn't need books, doesn't need the classrooms, doesn't need the entire setup of schools. They went out with their condensed, child-centric, customized methodology. They had their own packages of materials ready in their toolkit in vernacular languages, immediately digestible to children, and their teaching learning materials worksheets that they can use across the board. They work in small groups, tiny groups, to keep safety in COVID pandemics. And where they could not reach out to children, because some of our programs, you know very well, they're in very remote areas, what did they do? They work on dumb phones, sessions of 14 minutes with individual children being educated on a regular calendar throughout the week. And there are communities, tribal communities in Birbhum in West Bengal, or in the tea gardens in Darjeeling, who have locked themselves in because they don't want to be infected. In fact, they are not. And so we cannot go there with our programs, but we can still manage to reach them. And seniors manage to do that. So how have they been able to set up such a we can say a sort of mobilization for education, or a movement for education, or a people's movement for education, because they were already, CINI is already in the communities, through two main backbones: women's groups, women's self-groups, mothers, the mothers of the children, the main stakeholders, and children's and adolescents groups. So in our CINI method approach, we are already in the community. So it was CINI was able, on day one, when the government was in a shock, to be able and do education. So what happened? And I'm closing to keep to time. Within this very short period, and through this accelerated methodology that we tested out in the slums, in the payments, and so forth and so on, 14,000 kids have been reached with education inputs. We did not leave out the protection part, and through tracking of vulnerabilities, rapid tracking of vulnerabilities, 12,000 children have been reached out, 3,000 of them through Childline. And a shield has been created to protect them from illegal trafficking, from illegal adoption, which is taking place now in India among COVID orphans, from child marriage, a shield from child labor, and all the other vulnerabilities. 60% of the children have already been brought back to appropriate level of learning. So the loss for them has been already recovered, and work is going on day and night. So here we have a model. It works. And the organizations and the other speakers on the panels who are going to be with us today, they'll tell us more about alternatives. So there are many contexts where schooling alone cannot be the answer, but where we can enter with alternatives. The solutions the world is clamoring for may come from India. Let's use them. They've been tested out. All we need to do is to be ready for a people-oriented change, and we need to be ready to move fast. Thank you.
Thank you, Eliana. Yeah. Thank you, Eliana, and that was very concise and very good point. And I'm just reminding all the audience again that in case you have a question, you can put it in chat and Eliana would look at it. Now, I would like to invite Ms. Farida Lamhi as the next panelist. She has more than 30 years of experience as an educationist and social activist. She co-founded the very, very famous Pratham. I can't tell you how excited I am to listen to her, and I'm sure everybody is. As a former vice principal of Nirmala Niketan, which is a premier social welfare college, she reached out to different vulnerable groups and started initiatives which are now actually established organizations. She is a recipient of several awards, impacted policies on education and child labor, and she has been in many state and national committees. As discussed with her, she'll be sharing with us the highlights of ASR 2021 and recommend what we could do for closing the learning gaps. Over to Farida.
Yeah, thank you, Sulagna. We met years back, and thank you that you're saying you're excited, but I just have to say that we owe it to UNICEF, who really started Pratham and as a project, and here we are 26 years down the line. So congratulations to CINI for your 48th Foundation Day. I'm very happy to be here because I've worked with CINI before in my earlier avatar as Vice Principal, College of Social Work. Having said that, when you talk about education, and I think this August House knows, and CINI, of course, has always walked the talk, that education is a fundamental right of every child. It's an entitlement. So when we are looking at education of a child, we are not really saying that it is a favor or it's a charity, but it is that we as adults have to give children the right to education. And I think, and I want to say that Pratham has been looking at this, looking at education. Can you hear me? Because
yeah, we can hear you. Right.
Yeah. Sorry, I
can't hear you.
I think I have done something which.
You've lost your video. Huh?
Yeah.
Oh, there you are. Huh.
Sure. So basically, when we talk about ASR, and ASR has been a game changer, it has actually changed the discourse of education in this country, and of course now internationally also. This time ASR was a little different. We had to do it with the phone survey because we couldn't go physically. And what we found out I'm just going to give you a few highlights because I know there are a number of speakers on this panel. One important highlight we found was that the enrollments are kind of at 90%, and enrollments are there with children. But when we did this, schools were partially closed, partially open all over the country, and this is a rural survey. So basically, we found that attendance was low. And this is nothing new. Even pre-COVID, whenever we talked about enrollment as 98%, we always thought that the attendance was a huge issue in our country. Because at a given date, in any class, we never used to find more than 60-65% children present in a class. So there were always this, what we call is regularly irregular children in our classrooms, though we do welcome this whole aspect that 90% enrollment is there. Second, very important highlight which I want to bring to this table is that we found out that the enrollment in government schools has increased. There was a dip in the low-cost private schools, and the government enrollment had increased. And there were obvious reasons for this. One reason was that many low-cost schools had shut down due to COVID for various reasons. Second, parents were not able to afford the fees, and online education was not starting unless you had fees. So there was a financial distress. Migration was a huge issue, and it was a big factor. And the other important thing was that many of these schools where parents send their children during this COVID time were in the neighborhood. So all these years that we've been fighting for neighborhood schools was really coming into a real situation where parents felt that it's better to send my child in a neighborhood school, which is very close, and I don't have to really get into travel, because safety and security is a major concern. So that is the highlight. Third is everybody is talking about dropouts, that there are dropouts, but I just want to say that Asar was not able to capture the numbers in a real sense. And the reason being that there was fluctuating, that, schools were closed, schools were open. So I feel that all of us need to wait and see what is the real dropout, because it has changed, and it is different for different regions. It is different for urban, it is different for rural. And while I talked about attendance, we could kind of match it with dropout, but we were not able to see it in real numbers. The other one which we found, and which is again important, that 2018 access and possession of a smartphone was not so important. But in 2021, we saw almost 67 to 70% children in the rural areas having a smartphone, or their families having a smartphone. But what is important for us to understand here is that having a smartphone does not necessarily mean that you have got access. And as all of you might know, that we as families, in our families, will have 4 to 5 smartphones. In children who are from the vulnerable situation, children who are from the under-resourced communities, you will agree with me that will not have this luxury of having 5 phones. But when the father started working, you will have only 1 phone. The father used to take the phone to work. When he came back, he was trying to download whatever we were sending. So basically, availability of a smartphone, yes, there was an increase. But if you look at the access to smartphone, only 27% children really had real access. And or even in this, the higher standards had more access, okay, in the rural areas. The other one, which was very interesting, which I think you'll like it, in the sense you'll find it interesting, is that the number of children going into tuition classes had increased in the rural areas. And this, I just want to remind everybody that ASER is always a rural survey. It does not take into consideration the urban cities, metros, or urban areas. So in the rural areas, the number of children going to tuitions had increased. I had sent the whole data to organizers. At some point you can see it. I don't want you to show it right now because you don't have that much time. But it is an increase, and it's an interesting thing. That means the parents, community were very hungry for children to get educated, and so whatever source they had in their community, they were using. So I think that's an interesting bit here. The other one, which was important, of course, and which all of us know, and whether it's World Bank, whether it's UNESCO, UNICEF, call it whatever, Central Square Foundation, everybody is talking about learning loss. And I really feel that there has been a tremendous learning loss. ASER itself shows that there was a sharp decline in children's learning. Now, to tell you the truth, even in 2018, pre-COVID, ASER has been saying it for years together, that a standard 3 child does not have his grade level competencies, which means a standard 3 level child is not able to read a standard 1, which means that the standard 3 level child is already 2 years behind his level or grade, as we call it. Now, if you see this, it was pre-COVID. You can imagine what has happened during COVID, where schools are shut. There has been no education, okay, and there has been no physical in-person education. So it has been aggravated, and I have data for Chhattisgarh, Karnataka, where the government had approached ASER to do a ASER for their state. And there we saw again a sharp decline, standard 1, standard 3, standard 4, almost by 4 to 5%. And which is quite serious. Azim Premji Foundation University has had a study in 5 states, and they've also come out with the same statistics. So I don't think statistics is something which is new. I think we've all agreed that the learning loss is there, and learning loss is tremendous. Add to this is what is important for us to see is that children, when we are talking about online education, and as CINI itself will agree with me, my earlier speaker also talked about it, that when you talk about digital, online, you really know that online is not a substitute for teachers. It is not a substitute for in-person teaching, and has really not been able to reach out to every child. And when I say every child, I'm also talking about regular children. I'm not talking about high-end schools, because high-end schools, whether the schools are open or closed, children will learn. We are really talking about the masses. And even in the urban areas, we've done a survey with the Municipal Corporation of Mumbai and other cities. We found that 46% of children did not have access to a smartphone in urban areas. In a cohort of about 2,41,000 children who were tested just 3-4 months back, we found out that 35,000 children did not know how to read. And out of these 35,000 children, about 8 or 9,000 children were from standard 1. Right now, you will agree with me that standard 1 and 2, we are not even looking at them, because children who have been in standard 1, 2, and 3, almost 75 million children in India, we have not seen the threshold of school. And that's a very, very serious matter again, right? So I think the more we speak about problems, the more depressed you get. So I'm going to turn over a little bit to the positive side, because we are all positive, and we there is hope. Now, one more part, and I will come to positive. When you're looking at this learning loss, when you're looking at the access to smartphones, you're looking at children not going to school, dropouts. This gets accentuated by already vulnerable children. In Pratham, one of my unit, which I oversee, works with vulnerable children, basically disabled children, child labor, children who are of the commercial sex workers, children on the street, children in the institution. And if you really see this group, with COVID, they were the most disadvantaged, and they, all our work, including CINI's work, everybody, many NGOs who worked with this group, I all feel upset that all our good work has really gone back by almost 3-4 years. It'll take some time to really bring these children back to what we call is, I'm not saying mainstream, but at least where they work, because they've already disadvantaged. And with all this online education and not being to school has really put a bit question mark. I don't want to talk too much about child labor and all that, because my other fellow panel speakers will talk about protection. But one thing I've seen, and I want to reinforce what was earlier said, that we also run child lines, railway child lines and regular child lines. And the number of calls on child sexual abuse, women violence, has increased tremendously. And I feel that this is because everybody is at home. People don't know what to do. Financial problems are there, and women and children in any crisis that we have is always always women and children are the most vulnerable. Okay, so and I don't see anything new in this. Having said all this is a time when we are talking about, and as Pratham, we worked in COVID, during COVID, alongside, and one of our mainstay, I would say, we were successful in, is working with mothers. And I can say this, that whether it was ASAR or whether it was all our work, we found that if schools were closed, how did children learn? Who supported children in learning? It was the parents. And the young parents of today, India's parents, have high aspirations. They're somewhat educated, so they help their children in whatever education was concerned. Another good point which happened in Maharashtra and some other states, that government was able to actually see in terms of basically access of teaching learning material. In Maharashtra, almost 87% of children already had textbooks from the government, which is a good thing, right? But children didn't know what to do with it. Now, coming to the positive and coming to the way forward, because I know the time is limited. what we thought in Pratham and what we think what we can do is Pratham is, and we all can do, is let's reimagine education. Everybody is talking about reimagining education, which is fine. One of my CEO, for example, says that we can already either try and get the train on the track, or we can change the track. And we are the people who I think we want to change the tracks, because we need to look at education in a different. So what are some of the things that we can do? One thing which is very important is that let's accept that there's a problem and that there is a learning issue, there's a learning crisis. It was always there and it has been aggravated. Let's accept that vulnerability has increased, whether it is child marriage, whether it's girls' marriage, so we need to actually map this region-wise. And we have to help the government to really map it and come to terms with this, that this is a fact and it is not a figment of anybody's imagination, because we're not interested in inflating the numbers. Secondly, what I feel is that if you want to really take what we need to do, first thing we need to do is let's look at the national education policy. Let's take the help of national education policy and let's look at preschool. That is the Anganwadi, the preschool, standard 1 and standard 2. So let's look at non-formalizing the standard 1 and 2 in the school, because the foundation is going to be very, very important. And it is not that we are saying it now, we've been saying it from day one, that if you work on the foundation, you don't have to really then do remedial classes in standard 5th and 8th, and you're not passing the parcel. You need to work on foundation literacy and numeracy, as government is calling it now. But I would say early childhood education, everybody should really work on this and make sure that our children, and I'm not talking about high-end balwadis, I'm not talking about high-end preschools, because Pratham itself started its journey with the help of UNICEF in starting community preschool centers where a child could just play and be with a so-called teacher in the community, just to get acclimatized to, say, habit formation, cognitive development, as you may call it. I would not get into that, but I think the time has come to actually do once again the strong connections between preschool and standard 1 and 2. Second thing I would feel is that the time has also come for teachers to look at teachers as a very important unit, but look at it as a decentralized unit. Let the teachers be alone. Let's not the inspectors and the beat officers and the officials look at curriculum. I think the time is where we have to welcome the children. We have to see at what level they are, because all our studies have shown that the level has dipped at least by 2 years, 3 years. So we need to start, as Pratham calls it, teaching at the right level. And we don't have time again today, but I have sent the data in Chhattisgarh, in Karnataka, in Maharashtra, when we worked with the government and we've started this teaching at the right level, learning at the right level, there has been a far-reaching improvement, because you're going at the level of the children. And if any one of this group wants me to share this, we can of course share it, but this is important for us to do. Thirdly, what we need to also do is build bridges. That is, let's not look at hello, am I there? Sorry, I'll just finish in 2 minutes, because I know my time is up. What we could do also is basically look at parents. And I feel Pratham has been a big supporter and have worked continuously with parents, pre-COVID, in COVID, during COVID, and now. And that has been our mainstay. And I want to tell you that with parents, when COVID was at its peak, we were not able to go physically. Many of us were not able to go. We did 2 or 3 things, as you were also saying, Eliana, earlier. Is one, that we sent a lot of SMSs, WhatsApp messages to our parents, and we were getting feedback from them. Second, we did a very innovative program. I'm sure Calcutta is doing it in Maharashtra, along with the state government, SCRT, which is called a radio program, which we said school outside the school. You know, when people don't have TVs in the rural areas, poor people don't have TVs. They have only one channel, and TV was being used by many channels. What we thought is, let's start a radio program. And in the radio program, we started sending safety lessons, security lessons, and we also started sending quizzes, academic programs. And this Shala Bharti Shala, it is called School Outside School. The village sarpanch, mukhya, or the village pujari or the priest took it upon himself to make sure that his village heard the radio program. I feel this is important, and many of us can do this in our own sites. We must be doing it. But for us, it was a very important program to reach out to our parents. Another thing which we've done right now is what we're calling them the mothers group, whether it's a Jivika program in UP and Bihar, whether it is the savings group, or whether we call it the smart matas. We've called them the smart matas because we feel that these women, it's like a molla group where, because they can't go outside their lanes, they can't go outside a molla, they work with the children, with 5 children, 6 children, and this kind of creates confidence, and it creates what we call is a learning atmosphere in the community. So if tomorrow the school gets shut, this will continue. So we are a great supporter of parents groups, and we feel school is not the only fountain of knowledge. We can't depend only on the school, so we need to work with the community. And lastly, I want to say that vulnerability, children, child labor, I think these are problems which sometimes are ignored. So when we are looking at our plans, we need to look at their children as a special focus, especially children who are special needs, disability, because they have suffered. And I mean, we have worked with these children. So, we have worked with different ways. But once again, here, parents have really supported us. So we need to plan a little more for the vulnerable children. And I'm sure with civil society organizations on this panel and outside, will help the governments to work with the most vulnerable so that they don't get more vulnerable. So I think, let me end on a positive note, that we will be able to make a difference. We will be able to change, because children are resilient. So let's not get stuck what has happened. Let's not get depressed that children are not learning. Children will learn, but there is a right way of learning, and let the schools and the teachers decide how that learning has to be taking place. And please, let's start saying, don't worry about the curriculum. Curriculum is here to stay. Let us work with children and what they like and what they don't like, including the mental well-being of the children. Thank you.
Thank you very much, Farida. I'm sorry, I'm also calling you Farida. But I've known
please
you for
call
some
me
time.
Farida. I like it.
And for very good practical suggestions that you have given us. And I hope I can ask during the question answer section. I will now go to invite Mr. Avijit Mitra, who is the special segment of West Bengal, and he's responsible for ICDS and runs a very interesting scheme which has got a lot of acknowledgement and awards, I think, across the world. This is for adolescent girls, Konnashri. Over to Mr. Avijit Mitra. He'll be talking about the work of government of West Bengal, as well as how Konnashri has ensured that there is continued education happening during the lockdown.
Thank you, CINI, for giving me the opportunity to take part in this session. Actually, I would like to focus on the adolescent empowerment and the appropriate development of the adolescents from the age group of 11 to 18 years old. You know, the West Bengal has a big population of adolescents, about 18.21 million, of which 8.8 million are girls. Although the past decades has witnessed a notable change in the lives of adolescents, with many more being healthier, better educated, and more aware, they continue to face barriers that restrict their access to resources, inhibit their ability to make informed life choices, and limit access to education, employment opportunities, and to reproductive health care services. Adolescent girls especially are trapped in a vicious cycle as they face the multiple deprivation which impact their education, nutrition, health, well-being, and their protection. The Department of Women and Child Development and Social Welfare, State of West Bengal, is the nodal department for the formulation of social protection policies and services to the vulnerable populations. This department is a key stakeholder in the state to bring the broad strategy to promote sustainable and equitable development. Cognizant of the need to build the human capital of adolescent girls, the department has in the last decade sharply focused attention on reducing the vulnerability of adolescent girls to child marriage and trafficking, school dropout, reduction of teenage pregnancy, and anemia through some major initiatives. The important initiatives is the Konasri, as well as a very good, important, and bright program that is Konasri Prokolpo and Scheme for Adolescent Girls Convergence Program. This department has integrated some components that are the non-nutrition component of Scheme for Adolescent Girls, a centrally sponsored team, you know, with the Konasri Prokolpo. The Konasri Prokolpo, you know, the state funded, and the SAG, that is Scheme for Adolescent Girls, and Konasri Prokolpo is also the state funded. But the components are taken from the nutrition, non-nutrition component of Scheme for Adolescent Girls, that is erstwhile known as the SABLA. From the year 2015 to 2016, this program has been implemented in the state. For 15-16 to 17-18, we have implemented this program in 7 districts where the SABLA program was in force. But from the year 1890 up to 2021, we have been implementing this program across all 20 states in West Bengal. And you know, the prevalence of COVID-19 program, the COVID-19 pandemic has devastated in the child education and the child protection. In this scenario, the program like Scheme for Adolescent Girls and Konasri Prokolpo Convergence program is very important. And through this program, we have brought all the in-school girl students, in-school adolescent girls, and out-of-school adolescent girls from 11 to 18. We have focused more to empowerment and appropriate development of the out-of-school adolescent girls, especially from the age group of 15 to 18. Of course, along with the in-school adolescent girls from Konasri. During COVID-19, we have seen the adolescent is a critical time for the girls who have navigated the transition to secondary school or entry into the labor force market concurrently with the onset of sexual activity and childbearing. Experiencing a shock such as a large-scale health crisis can intensify these challenges and shrink the spectrum of opportunities available to them in irreversible ways. It is noteworthy to consider the specific vulnerabilities faced by adolescent girls and policy measures, which are essential to support and empower them throughout the COVID-19 crisis. In the context of COVID-19, there is a real worry that school closures might eventually lead to more girls to drop out, limiting human capital accumulations in the long run. The interruptions in schooling is also likely to increase domestic responsibilities for girls and lead to a premature shift towards the income generation. Moreover, being outside of the protective environment provided by schools may make girls more susceptible to early pregnancy and gender-based violence. The safe spaces or girls clubs combining life skills and livelihoods training are an increasing popular model for empowering adolescent girls that's been proven effective in a variety of contexts. Evidence shows that the community-based programs have not only increased girls' self-employment and earnings, but also reduced the pregnancies, boosted self-confidence, and eased anxiety. The SAG-KP convergence scheme has the potential to help the post-COVID response and recovery plan and meet the stated objectives of empowering adolescent girls. This program has again been launched from January 22 for 3 years. The state government has given us the permission to continue this program. CINI has given us the support as the state partners. They have done a lot of works in the field in helping the district administration for preparation of the plan and to mobilize the adolescent girls into the biggest platform in the state, that is the ICDS platform, and coordinate the human resources, that is the project coordinators and field facilitators of this program, this convergence program, with the district and the ICDS authorities. As a result of which, the adolescent girls in each habitations are under the fold of the government, and they are being looked after by our huge voluntary workers, that is about 930 voluntary workers as the field facilitators. They are engaged to reach to the vulnerable people of adolescent girls, especially the Kanyasri girls and the adolescent girls of 15 to 18 years. They have reached to the remote corners during this COVID period, in the like the Chit Mahal in the Kuch Bihar and in the Jungle Mahal, even in the tea garden, by home visit as well as by the WhatsApp group. During this period, during this pandemic, all those people are under our care, were under care during this period through this huge manpower engaged by this department, through the reputed community-based organizations and the non-voluntary organizations. There are, apart from the district, apart from the state authority of this department, each district has formed a district level coordination committee to coordinate the program, the various components of the program of this convergence program. This committee has the highest level authorities as the chairperson, that is the additional district magistrate chair this committee, and from the health sector, Deputy CMO is 3, is the member of this committee, 1 member of the district nodal officer of Utkarsha Bangla, because our program has 1 component, that is the vocational training. Those who are not interested to continue their education, apart from this, the Kanyasri girls are also engaged for this, taking this training. And and all the ICDS functionaries, that is CDPOs and district program officer, they are also the members of this committee. This committee are supported by the district coordinator, deputed by the CINI, I know, and this CINI people helps this committee to prepare the plan, to prepare the monthly report, and to send the report to the state for actively, effectively monitoring of this program. So during this post-COVID period or the during COVID period, the state government has successfully been able to reach the people. And overall, apart from CINI, UNICEF has played a very important role to launch this program. UNICEF technical consultant helped in the state level, and also they rushed to the remote area, rushed to the project level and the district level, along with the CINI, to train the people like our voluntary workers, Anganwadi workers, as well as the human resources of the NGOs. And also the adolescents representatives that are called Sokhi and Saheli, the two representatives from each Anganwadi centers, they are called Sokhi and Saheli. They are trained and oriented, and with the programs components like ours, that is nutrition, health education, lively-based, land-based livelihood program, and IFS implementation. These are the components, and they took part in mobilization of other adolescent girls. Those are called the Kishori Samuho. So with the help of CINI, UNICEF and the state government has launched successfully this program, has been successfully implementing this program in the field for the appropriate development and empowerment of the adolescent girls of 11 to 18 years old. I hope the CINI will contribute more in the field to bring the success of this program for next 3 years, and also they will depute the appropriate human resources in some project areas so that effectively this program is will be implemented in the state of West Bengal. Thank you.
Thank you, Mr. Mitra, for telling us in detail about the Konyashi program. And it is so reassuring to know that there is a safety net for all these adolescent girls in the area that you mentioned. We are now taking a little break from this panel discussion. And after that, we'll open it for question answer. But at present, we have a special guest, Srimati Ananya Chakraborty Chatterjee, who is the chairperson of West Bengal Commission for Protection of Child Rights, who is going to address all of us.
Thank you very much for inviting me on this very special day. Usually I'm there for every, on the occasion of CINI's Foundation Day every year. And we usually have a face-to-face interaction, which is so wonderful. But as we know that the times are different now, so I have to, so therefore I have to, we have to meet virtually at this point. I'm very happy to be here, and we know that CINI does wonderful work. We have been teaming up with CINI recently on vaccinations of teens, of vaccinations between 15 to 18, especially those children who do not have valid documents. As we know that the schools are getting their children vaccinated, there are families who are getting their children vaccinated with papers, but there are a lot of children who live in street situations or who are orphans. They do not have the regular documents, and there's no one to guide them to the vaccination centers. So along with CINI and some other NGOs, but CINI is coordinating it, the commission is working on the vaccination of these children, because as we know that no one is safe unless everyone is safe. So this is the latest project that we are doing with CINI. But working with CINI is always a pleasure, especially Master Moshe. We love you, and it's always a privilege to work with you. And I was listening to most of the conversations, even though I was muted and my camera was also not on, but I was listening to most of you, what you were saying, and it is always a very enriching experience whenever CINI does something. I wish CINI all the best, and I hope that next year we will be in a more fortunate position, and we will be able to meet face to face. And by next year, we will be having a lot of work. From now to next year, the work will be of rebuilding in our state, rebuilding our state, rebuilding the children, the future of children here, ensuring that they go back to school, ensuring that they are freed from child labor and brought back to school, ensuring that there are no more cases of child marriage, which have been happening because of the pandemic, because the schools were closed, and ensuring that children are safe, they are going to school, they are able to cope up, because we know that there was a huge educational loss because of the 2 years of the pandemic. So we have to all work together to make sure that children are going back to school, that they are getting educated, that they have regrown their interest in studies. That is going to be a very huge task, because as we know that education is often a question of habit. They have grown used to not going to school. So we have to all work towards finding out methods of how to ensure that they go back to school. What are the new methods that, we have to find out innovative methods. With these words, I would like to end, because a lot of us were speaking and we heard a lot of you, and I wish you all the best. Thank you.
Thank you very much. It was interesting how you called Dr. Chaudhary Master Mashai, because we always thought of him as Dr. Babu. Anyway, now coming back to the panel discussion, any questions? We can have 3 questions before we go to the next lot. So you can just unmute and start talking. Okay, if nobody has a question, I take this opportunity of asking. I wanted to ask Farida that suppose children have lost out on 2 years of schooling and all that, and they are in their elementary age, will a reading guarantee program or a reading program help them to get back to the level of learning? In case there are no more questions, or I don't know if Farida has not answered, I'll go to the next speaker. I'd like to invite Ms. Rema Mohan, for the CEO of the NSC National Stock Exchange Foundation, for her talk. She has more than 25 years of experience in CSR and has worked with several organizations. I'm very well versed with her work of Rajasthan, which was when I was the education specialist there, and have seen her work in the KGBVs and the Girls Transform, with the life skills and academic skills, as well as good hygiene behavior. Besides that, she has designed low-cost pedagogic methods to enhance English language skills among primary school children, and her contribution as a core team member of Teach India, Lead India, and Teach India program is well known. We look forward to your talks, and Rema, it's so good to see you again, and again moderate when you are in a panelist. Remember the last one in both, yeah? Okay, so we look forward to your discussions on CSR role in continuing education post and during COVID-19.
Yeah, Sulagna, it's so wonderful to see you. It's been quite a while, and I know a lot of the panelists personally. Hi, Farida, and it's such a pleasure also, CINI, to be a part of your celebrations, and I wish you all the very best going forward. I think today NGOs are playing a very critical role in translating a lot of the government initiatives on ground And I think the NGO role, which is really they need to re-strategize, reinvent themselves also as to how they're going to really carry this into communities, the initiatives of the government, align with the government, and not replicate work, really converge and collaborate with each other to ensure that there is improved impact on ground. I think these are things that organizations will also need to think of as they grow and as they look at the way forward. Of course, post-COVID is something that, not really post-COVID, but really going forward. And I think if the studies are to be believed, a number of other such pandemics are going to break out in the near future. The increasing incidences of such pandemics are something that we're going to really see. Then what happens to society, what happens to people, how are they reconstituted, and how will we ensure that these basic services are reached to them is something that we will all have to in the coming years really look at very closely. And I've been asked to speak about a couple of things. Really, we at NSE Foundation, also just to give you a very brief background on NSE Foundation. NSE Foundation is a Section 8 company. It is the implementing arm of the CSR activities of the NSE Group, the National Stock Exchange, and its subsidiary companies. The National Stock Exchange is the number one stock exchange in India, which is responsible for a lot of the equity and other trades that happen in a lot of the financial segments that we have in the market. And NSE Foundation is the CSR, as I said, it's the implementing arm of the CSR activities. We are today really looking at the spectrum, which starts from education for children and which goes right up to the elders, the senior citizen. In between this, we also work with youth for skill development, water, and sanitation, health, because all these also cross-cut this life spectrum that is there between the small children and the senior citizens. When it comes to education, yes, we are working in aspirational districts. We work with almost 20-25 organizations impacting a large number of children. Really, if you look at the model that we had put in place, we realized that in the rural areas, due to whatever reasons, when children go to school, they're not able to learn. And many of these students, many of these children are first generation learners. They're not exposed to print media. They're not exposed to any visual media around them. So to really get them to focus and learn was quite a task. We also realized that we need somebody to translate things for them, have the role of somebody like a Shikshan Mitra, somebody who's a friend of learning, a friend of the child, who not only teaches the child, but is responsible for other things as well. It could be some learnings on hygiene. It could be something on health. It could be on good practices, life skills. Like I remember there was little hamlet in Maharashtra, which was entirely, and there are a lot of people who lived on the outskirts of the village. So they were seasonal workers who came, settled there, and they went. But then, and to integrate them into the village, into the schools of the village was a very difficult task. This was, I think, somewhere in 2017. And that was the time when the schools were made to upload all their data into computers. So initially, when the Shikshan Mitras went to the schools, they tried to make headway. They found it difficult. But later on, when this rule came that all the data had to go up, they offered to help them, help the school heads or the school teachers and say, look, we'll help you to upload the data. So that was how this relationship started. And slowly these migrants who were living outside the community, and so many children were just wasting their time. We said, look, let them come and sit in the school. Now, what happens when they came to the school, in spite of having whatever cards or being enrolled or whatever, because they had not had a bath, since obviously they were staying outside the, outside this hamlet. They did not have access to water. They did not have bath. So they were made to sit right at the back of the class, with the result that they really didn't learn anything and they really felt isolated. So slowly the children had also started dropping. So this whole exercise of getting them back into school and integrating them into a systematic schedule was what was the challenge. And because of the single rule that came out that people had to upload the data, they were successful in getting the teachers understand the problems of these children and also get the children integrated into the school. And many of these children had to walk almost, I think, 2.5 to 3 kilometers every day, cold, heat, or rain, to reach the school. And so the Shikshan Mitra is not only the person who teaches, it's a person who really does a whole lot of other things. And incidentally, trying to get the children to school, they realized that most of these children were very good at sports, encourage them, enroll them for block level activities, sports, sports competition at the district level. And these children, and I think 3 of the girls in that group had actually got a sports scholarship in Pune, and they were enrolled in one of the schools, the sports school. It's a small change, but it really fundamentally, it shows that a mentor, a community-led youth or other mentor really plays a very, very, important aspect in the child's learning, the child's development, because education is not just about literacy, it's about all the other things that go with it. Because if education was just about learning, all of us could have just sat in front of a screen and learned, but that's not possible, isn't it? So that's a model under which we sort of anchor our education initiatives. It's a role of a Shikshan Mitra, and then the community connect, the SMC connect, and SMC people are members of the community, they are parents. So really trying to get the entire community to accept the role of a school and say it's not something that somebody else is doing for you. This is an integral part of our life, our children's life, and we need to be also involved in it. So I think that is how we like to work, and we feel that this is a success. Now, coming to COVID, we did find that this entire Shikshan Mitra theory, or this model that we were running with, gave us a good dividend, simply because these were people from the community, so they were able to run community centers. We've just wrapped up a study, which is rather a concurrent study, because we had data pre-COVID, we had data during COVID. Of course, the numbers might have come a little lower. So if the total numbers that need to be reached out were 5,000, we were able to reach to around 2,000 in that particular cohort. And what we did find, and incidentally in Nandurbar, where we were working, we 5 different models that are running there. Working with the school, working with the community, working in Balba, also working in schools where one of the rooms is converted into a learning center, working with ashram shalas, with adaptive software. So there are different models that we had. The sum and summation of this whole thing is that, yes, we need somebody to translate education at community level. We need that person who's a mentor or a volunteer to really anchor these programs, anchor education, anchor learning within communities. In that way, we also seed the community with available resources who are educated, who know to teach, and who can take that forward. And that can spill into a lot of other things, like a CSC. It can spill over into agriculture. It can spill over into skill development. It's not only the domain of, that you have to teach the child. That person who is trained as a Shikshan Mitra, who's also trained in other aspects, because when he comes to us as a Shikshan Mitra, only one aspect is education, but the sort of training that he gets in life skills and other things goes beyond that, which will allow him to further involve himself in the community and encourage him to take the other things forward within communities. Could be any one of the other aspects. Don't want to get into that. That will go into a tangent. The second thing, yes, I agree with Farida that the smartphones, because we did have tablets, we did have smartphones, we did use devices, we used apps. Smartphone usage, I think around around 35 to 40% is what is the number of smartphones available with that population, rural population, and really far off rural populations. But again, I do agree, with my co-panelists that the access to these smartphones is very limited. It could be the father who's using the smartphone. Many times these smartphones are secondhand, so they're not the fancy ones that we get. So that's also a challenge. Boys seem to have more access to smartphones than girls. Yes, I also agree that from our study, we find that children have been, involved in agriculture, other work that is there in communities, in their family. But also, it's not necessary they've only been involved in work. They have been really, technically, there has been nothing to do. So they have been, what some people, some of our NGOs said, they just roam around the whole day. They go into the forest, they go into the community. They have a gang of children who are just going around. Why I'm using this word, and very consciously, is that what we also found is that when things are unstructured, you may have a community center, but the learning does experience a loss. So the learning of the child is not as high as it could have been if it was a structured activity within the confines of a school for that 4 or 5 hours that the child is there. So community centers at best can serve as an add-on to the actual school process. What can the government do in these cases? I believe in the structure of a school. I believe that they need to create a cadre of community volunteers, include and encourage the community to participate in this whole process. There has been a learning loss. I don't know whether we call it regression or learning loss, because after a point of learning loss, it becomes a regression, right? So it is quite bad. And I was just back from, and one more thing, I must mention here, the structures within the government are very good, because there is one school under the government system, which reaches out to girls. And these are called KGBVs, and they are residential schools. And they are in usually the educationally backward blocks. Most of the states like MP, Rajasthan, Bihar, all these places have a large number of KGBVs. Some of the states also go as far as to have their own state hostels. Now, I was there in the KGBVs for almost a week, a few weeks back, I think starting end of December. And a lot of the children, I did get to interact with a lot of the girls. We've also done a study, Sulagna, you may be interested to know, where we've conducted a study on 40,000 children who passed out of KGBVs and whether these KGBVs really fulfill the need that they were set out for, and what the girls are doing, how many are graduates, how many have got married, how many are working. So that entire data is there. I can share that. That will really excite you, and it'll be quite informative to you. And yes, there again, we find that, these structures within the government which create a heaven for these girls are really needed. Today, we are at a stage where we need to close everything and privatize things. But I don't agree with that concept, because these girls, a number of them said they were so happy to come back to school. So yes, one is those residential schools which fulfill that need. The other is, of course, the ZP schools. Whatever we may say, there is no teaching happening, but the entire discipline of the school really fulfills a need, because our studies show, much as you may have community centers and other things, the learning is not as much as it would have been during the time when the schools were open. So I think schools really, really play a very important foundational and fundamental role. I also feel that we need to start at the basics. And yes, the new education policy talks about foundational learning and literacy. Foundational learning and literacy is very important, because post-COVID, or if you look at COVID as an incident that has happened in our lives, going into the digital era, where you even have MSP being, you get an SMS saying that the MSP has, the MSP for the crop that you have, given the government has come into your bank account. A person needs to have foundational level, of some literacy to understand these things. So digital education needs to be put through on a war footing, because these are the children in the next 10 years. they need to be digitally literate. So I think this is also another, and we can't assume that because, oh, it's this new generation and everybody is digitally literate, everyone's playing on this phone. I don't think that's really true of the rural areas. So I think this is something that really needs to go on a war footing, both to the parents as well as to the children. So these are a few of my thoughts, and thank you so much. I mean, there's so much to talk about with such an erudite panel. It's the meeting of minds and meeting of people who are in the and feel so passionately about the things that we do. But these are a few of the takeaways that we have found from our programs. We've tried different models, but I think at organizational levels and at the program level, and then I have summarized, I've tried to very briefly tell you what the findings were. So with that, thank you so much and wish you all the very best. And thank you, Sulagna, for being there as the moderator.
Thank you, Rema, for giving us some very useful insights of what can be done in this new situation. And I hope you will stay there if there are a round of questions for you. On this note, we would like to now invite Mr. Ranjan Kumar Mohanty, who is a chairperson of NACG, which is the National Action and Coordination Group for Ending Violence Against Children. He has 32 years of experience in development sector with special focus on child rights. He has, I was reading his, what was written about him on the web, and I was interested to know that how he facilitated the release of 35,000 child labor, from labor to education. So that would be a very interesting, maybe some other forum. He is a co-founder and secretary and CEO of People's Cultural Center, which is an NGO in Odisha, as well as the chairperson of Child Rights Alliance. He has led several research and publications. Mr. Mohanty, we are really looking forward to hearing from you how the impact of COVID-19 on child protection scenario. We heard a bit about it from Eliana, but we would like a little more to get to know from you. And as well as if you could guide us on the role of government, civil society organizations in protecting children.
Yeah, but thank you very much, Sulagna ji. Many congratulations to CINI for observing its 48 years of 48 Foundation Day. 48 years is not a small time. I think CINI has achieved a lot. So on this occasion, on behalf of National Action and Coordination Group for Ending Violence Against Children, I'd like to congratulate the whole CINI family, CINI team today. See, one thing I would like to tell that I was listening all the presentations. Thanks to Dr. Eliana, who has brought a lots of things actually, because he was talking about child protection. She was talking about even if as part of the civil society role also, she was talking about CINI's role. She was talking that 3,000 children, have been prevented from child trafficking, child labor, and all these things have happened. So it shows the way actually. These things that shows the ways. So what one civil society organization should do. The Union government enforced the nationwide lockdown on March 25th of 2020. And after that, if we found civil society organizations have done lots of work throughout the country, many, because they have supplemented, they have coordinated, they have converged the programs with the government. In many places with government, they have worked. There are lots and lots of examples. They have provided foods, they have provided first aid, they have provided ambulance, medical supplies, whatnot, many things, whatever required. And the most important thing is the creating an enabling environment, creating the COVID appropriate behavior, promoting the COVID appropriate behavior at the grassroots level also. All these things have happened. Regarding the protection issues of children, I think because already Dr. Eliana has elaborated many things. See, as per the UNICEF, 10 million additional girls are at risk of child marriage due to COVID-19 globally. And even if we talk about child labor, lots of studies and researches are coming up now. Child labor, the trend is increasing. The trend is increasing. We have whatever we had, succeeded to achieve earlier. Now this COVID-19 situation has again taken us back. Because we are talking about education. I was listening to all. We are talking about education, and it may be 27%, it may be 30%. It is not a very big thing. And finally, what has happened? This online education has not reached to all. It is not only, it has not this increased digitalization. It can also, magnify the risks such as sexual exploitation and cyberbullying when we are talking about the situation of the children in COVID-19 situation. It is not only the access to education. They have a very less access, very less children have access to the education, one side. Another one side, who are getting access, I have seen in many places, even if some coaching centers, some teaching, it continues till night, 12 midnight, 1 a.m. midnight, like that. So, and sometimes this digitalization process, this entering into the Android phones and all these things, it has also made children more vulnerable during this COVID-19 situation. Yes, technology is very good. I have no problem with the technology. But if they are not supervised, if they are not properly guided in the families itself, the vulnerability has been increased. And we found the increase in the cyberbullying, sexual exploitation, even if trafficking and all these things. So that is another one part of this use of this technology if they are if they are unsupervised. That has only so online education not as only even wider gap between advantaged and disadvantaged children. It has also increased vulnerability to the cyberbullying and all these things due to the unsupervised things. Another one major things which have not been emphasized, I would like to emphasize only 2-3 things. See, many things have happened. Even if children, the civil society groups, they have supported the children to come out with the COVID protocols, abiding by the COVID protocols to the learning centers. As I was looking at, CINI is already doing it, and many other organizations, they are also doing it, providing the safe space for the children how to come out. Because otherwise, the most important thing is that children are now at the home. They are not going to their friends. They're not playing. They're not enjoying their childhood, I can tell. And it has increased. There is a mental health is emerging as the biggest issue, I think, and which is going to have a very bigger impact on the children itself. So that is most important thing we need to look into, because children confined to their home during the pandemic and faced violence, abuse, as they were cut off from the support services system also. They are literally cut off from the support service centers. Even if girls became more vulnerable, even if the mental health condition, the mental health situation, even if many children, we found that they are going to the depressions also now. So all those things need to be addressed when we are talking about how to support the children. One more thing, you must have a new vulnerable group has emerged out of that also. The National Commission for Protection of Child Rights has informed the Supreme Court recently that a total of 147,492 children have lost either their mother or father or both due to COVID and other reasons since April 2020. And this is basically based on the data uploaded by states and union territories in the Bal Swaraj portal, COVID Care, up to January 11. So this is now going to emerge as a new group of vulnerability. Because how we are going to address that issue also? Many orphans have been, become prey of all this COVID-19 situation and all these things. That is another one thing we need to very seriously think, that how those children are going to get the services. That is most important thing. Even if for the social protection measures, it needs to be expanded also to the children and their families, to protect the impact of to get them out from the impact of the COVID-19. So there are lots of things. Even if if we talk about the children, access to health and nutrition services, even if vaccinations are coming up for the children, but whether now there is a role of civil society to see that the children are many places, there are different myths also. We need to look into that the children when their age is coming up, they need to take the vaccinations, and there I think we have a role to play. So there are lots of things we can do, but I think one of our co-panelists, she was talking about the convergence, coordination, and collaboration. Yes, that is the most important thing. That is the most important thing. We need to stress on that. And there also the civil society can play a very vital role to bring all together, to bring all the key stakeholders from at different level. And the most important things, as Dr. Eliana was telling, that preventing the children from child labor, from child marriage, how we are going to do it. And it is definitely developing and promoting some type of child protection mechanism at the community level. Unless we develop and promote the child protection mechanism at the community level, it will be very much difficult to prevent all these things. Even if the post-COVID situation is going to be bring more vulnerability for the children. When they will go to the schools, slowly schools are opening, they will be going to schools, or they are going out of family, they are going to out of community. So the things are going to, more vulnerable, more vulnerability may be coming up. It may be related to, we have to look into whether dropouts are increasing, child labor is increasing, child marriage, all these things are trafficking, all these things may need to come. Even if this child sexual abuse also, we found that the children have become the victim of the child sexual abuse by the people who knows them, because children are only now in the family and nearby the family. So that needs to be taken up also. So I think these are the major things I would like to share today. I don't want to take much more time, but most important two things again I want to stress. One is community level child protection mechanism needs to be strengthened, and another one thing, we have to look into the mental health situation of the children. If we can provide, even if barefoot counselors also, or some type of counselors at the community level, creating those type of facilities, services, that also very much work for the children. Thank you very much.
Thank you, Mr. Mohanty. That was really very useful. You also actually scared us, and that is important, because we have been hearing about education emergency and all that. Now it seems like also a child protection emergency, which is so important. You have given us some very good inputs of what people can do, what government can do, what civil societies can do. The last speaker, before I go to the last speaker, I just want to say that there are certain questions that has come through YouTube and Zoom chats and all that, so which we have noted down over here. At present, there's one for Rema and one for Farida, but we will finish the panel discussion. By then, there would be more questions coming. And after Ms. Bharti Ali's presentation, we'll go down to the questions. So we come to the last, but as I say, not the least, presentation by Ms. Bharti Ali. Is she there?
Yes, I'm there.
Okay. So she's the executive director of HUC, and that is the Center for Child Rights. She has more than 28 years of experience as a development professional and social activist working for rights of women and children. Besides HUC, She is also trustee and president of Child Rights and Sustained Trust and the governing body member of Jagmat, which is an NGO based in Delhi. Among other things, she holds a lot of experience in research, training, and has been constantly advocating for child rights, child protection, and justice for children. Like the other panelists, Ms. Bharti Ali has also impacted government policies. And we are looking forward to a very, very important and disturbing topic of gender-based violence among children during lockdown. We're looking for your inputs on this now.
Well, thank you so much. And thank you for that elaborate introduction as well. Like you said, yes, very disturbing trends have already been shared, and I'll probably add to that. Today is the day when the country gets its budget for the next year. And I think I'll begin on that note, just to let everyone know that the budget for children has been witnessing a decline, since 2012, 2013. It was 4.76% of the union budget. And today the share of children in the union budget is 2.35%. And that's like cutting it into half of what it was in 2012-13, and something very serious, something that we should all be concerned about. Within that, we are yet to look at what is there for the girl child specifically in this year's budget. But if I were to look at the trends in the last 10 years, or say since 2013 and 14, very clearly, the share of the girl child in the union budget has on an average been 0.12%. And which is really, again, telling us on how much we care for the girl child. What are the kind of programs and schemes we are investing in? I'll run you through some of those as well a little later. But there are critical concerns, beginning from the very right to name, nationality, and identity. The fact is that despite having improved birth registration in the country, we still have not improved the system which helps us get a birth certificate. And often enough, it's the girls who are at a loss when it comes to that document called the birth certificate. Something we again need to be cognizant of, because I mean, what I'm going to talk about today is this gender divide. Therefore, beginning with the very, very basic right to name, nationality, and identity. We've also in the last few years witnessed, protests around the CAA, NRC, for whatever reasons, valid or invalid. But it has had an impact. And when we did a little fact finding in Assam, we found that there were, again, a lot of children who had not made it to the National Citizens Register and were therefore more vulnerable than others, to the extent that they were being ridiculed by their own peers in their schools, saying that, I made it, you did not make it. And, so their peers were making fun of others who couldn't make it to the NRC. So that's one part, besides having, having been pushed into camps for no reason. And these are serious issues. I'm really talking about issues that often enough don't fall into our radar of interventions and programs, but we need to be cognizant of these. Moving ahead, I'll talk about child sex ratio. All of us are aware that the last data that we have is the census 2011 data. There's some data coming from NFHS 5 as well, which indicates that the overall sex ratio in the country has definitely improved, but the sex ratio at birth still remains a concern. We don't have a correct figure for child sex ratio based on NFHS 5 as yet. I'm not able to present that, but Again, falling back on the census data, it says 919 girls per 1,000 boys in the 0 to 6 age group. The worst is the adolescent sex ratio, again, something to which we really don't pay attention. You know, for child sex ratio, the reasons given is sex selective abortions and, you know, the craving for a male child. But what about adolescent sex ratio, which is only 898 girls per 1,000 boys in that age group? It's worse than the child sex ratio. So the question to ask is, where are these girls disappearing? What is happening to them? Some of it may be explained in the phenomena of trafficking, migration, but some of it is also explained in the fact that many of these girls get married. They're no longer counted as girls once they're married. And many of them also succumb to teenage pregnancies. And there are reports from UNICEF, from Lancet, a lot of research reports indicating that, you know, pregnancy-related complications are a cause of a large number of deaths among girls between 15 and 19 years of age, something we should really be concerned about. I'll also later at some point talk about the kind of response we are trying to give to some of these situations. But at the moment, I'll just share some data. Although NFHS is very clearly showing a decline in the number of child marriages, the fact is that India is still, you know, a country with the highest number of child marriages in the world. And there are some states, you know, where number of women aged 20 to 24 who were married before 18 has increased as per NFHS 5. States like Assam, Manipur, Tripura, you know, again, requiring attention. We see gender differentials even in infant and child mortality rates. So while the NFHS may be saying that we are improving on you know, infant mortality rates, the fact is that you know, the mortality, the under 5 mortality of girls far exceeded that of boys. It's a study, you know, which the United Nations Interagency Group has brought out, called Levels and Trends in Child Mortality. NFHS 5 and 4 comparison is also telling us that, you know, there is a huge gender gap in under 5 mortality, particularly in states like Jharkhand, Bihar, and Uttarakhand. Now, there are studies which tell us that, you know, girls have a better immunity level and have a biological advantage in survival over boys. Yet, if we are witnessing these gender differentials, it should be a matter of concern. Malnutrition, again, you know, tells us, which is actually a significant factor for under 5 mortality, especially for girls in India. And it remains 8.3% higher for girls than for boys, as per the NFHS 5. So there's lots of nice things that NFHS 5 is telling us, but there are some things to worry about as well. Stunting particularly, you know, is something which has witnessed a reversal as per NFHS 5. And therefore, you know, everything about child nutrition is, you know, the improvements that we are witnessing can't be taken on their face value. We need to look at the detail as well. Records on anemia are again telling us that anemia in women in the age group of 15 to 19 years has increased from 54.1% in during the NFHS 4 to 59.1%. Similarly, anemia among pregnant women aged 15 to 14 has increased as per NFHS 5. And again, there are reports which tell us that anemia affects about 40% of adolescent girls compared to 18% of boys in that age group. The gender gap is very, very evident. Reports also suggest that nearly 25% of girls and boys do not receive any of the 4 school-based services, which is midday meal, the biannual health checkups, biannual deworming, weekly iron and folic acid supplementation. And all of this, impacts. We've been talking about education and enrollment and dropouts, but all of this actually impacts presence of girls in the education system. Interestingly, data is also telling us that although pandemic has really reduced the space for children to move and to exercise and carry out some physical exercise, but even otherwise, without the pandemic, there is data which tells us that compared to boys, adolescent girls get to spend only 10 minutes per day on physical exercise and play and those kind of activities, whereas boys get about 40 to 50 minutes per day. The pandemic has taken it away from both girls and boys. But this is again something that we need to be looking at. Physical exercise, right to play, right to leisure for girls, as we talk about right to education. We've talked about the digital divide in education. There is enough data and now enough research, telling us that, only about 35% of internet users are females. So we can imagine, that's irrespective of pandemic. And the pandemic, of course, made it worse. And within the education system, the online, education system has particularly deprived persons with disabilities of their right to education. We haven't been able to cater to their needs as such. And again, going by the 2011 census, there are about 1.18 crore women with disabilities. So we can imagine what impact it has had on girl children with disability and their education. Ranjan talked about child labor. Yes, a large number of child labor. There is an increase in the number of child labor due to the pandemic. And a large number of girl child labor is in the agricultural sector and other, informal sectors, but largely agricultural sector. Most of them remain the largest part of the largest invisible workforce. The pandemic has made things worse. Reports on trafficking are there. There are reports also on, increase in child marriage and child labor. If we look at the trends in crimes against children, we see that, within the IPC crimes, kidnapping and abduction of children has the highest number of cases. Within that, kidnapping and abduction of children for marriage is the highest. And that's something to think about. I'll come to that a little later because I really want to make a point there. This is followed by crimes like
something, Bharti?
Yes.
That since we have also questions and question for you too. Can you just tell us what we need to do? Because we really, that point that you are talking of, and then we can open it for question answer. Sorry to interrupt you in the middle, but
yeah, I'm coming to that. I'm just coming to
that. The organizers are telling me to quick.
Sure. I'll quickly come to that. So what I'm trying to say is that there is an increase in number of cases, crimes against girls, particularly sexual crimes against girls. But a lot of, the kidnapping and abduction cases that we are witnessing now, particularly for marriage, are also cases of romantic relationships and increased criminalization of romantic relationships. And the question that I'm raising is that, are we really listening? Are we really collecting enough evidence to tell us what needs to be done? There are reports which say that there is an increase in child marriages during the pandemic, and I guess the results will be evident in the next few years. But is the answer to that? Does the answer to that lie in increasing the age of marriage from 18 to 21 years, a question we all need to grapple with today. A law always has legal implications. We can't shy away from that. That's a fact. There is a law, it has to have certain legal implications. The implications will be for the children who are in marriage as well as their parents and families. We have achieved success in reducing the number of child marriages by investing in education, by investing in issues of sexual and reproductive health rights, in programs for adolescent girls. But today, while on one hand we are cutting the budget for these programs, on the other hand we are trying to bring in laws which are increasingly criminalizing certain choices that children and their families make for whatever reasons. And that's a question, we really need to think about. So having said that, since I have to wind up and there is very little time, I mean, I can just quickly tell you that, there are schemes like Beti Bachao, Beti Padhao, where, the budget has largely gone into media and publicity, but again, it has witnessed a decline of 60 crore rupees. Similarly, the scheme for adolescent girls, has witnessed a decline. There is, just about any scheme that you look at, whether it's Samagra Shiksha, whether it's, the Swadhar homes, all of them have witnessed a decline. So where is that concern for the girl child? What are we really looking at in terms of the gender divide that is only widening across the spectrum of rights that we talk about today? Therefore, the need actually is to invest in both micro and macro research, as much as investing in creating community level mechanisms that will act both as preventive measures as well as watchdog bodies that can monitor what is happening with the government programs and schemes. Why are we not being able to connect people to the government programs and schemes in digital India? We need to understand those issues. We figured out when we were looking at children of brick-kiln workers that once they are registered in the Anganwadi program, in the Anganwadi center in their source areas, and that being computerized now makes it difficult for them to re-register from the area where they travel with their parents, which is the brick-kilns. Once you are registered in a computerized system, you can't re-enter. We need to figure out those issues and answers to those issues, and work on technology to provide solutions where no child is left out because of technology. So I'll leave you with some of these thoughts. I know CINI has been investing in creation of village level child protection committees. I think that is another area that continues, that requires a lot of work, considering that the budget for the integrated child protection scheme has really fallen down. Most schemes are being merged with a lot of other schemes, but with budget cuts. So, these are the kind of bodies and mechanisms at the village level that we really need to set up and invest in. So creation of evidence, investing in community level mechanisms, investing in technology that can actually improve access to schemes rather than deny access to schemes. I'll leave you with that thought. Thank you.
Thank you very much for your inputs. They're very useful. We now open it to questions. And I think Rema has just said that she has to leave. So we will be sending the questions to her. So I'll go over to Farida. Farida, are you there?
I'm there.
Okay. So the question to Farida ma'am, as it came in YouTube work, how could the available new age technologies be used to reach out to children who remain unreached by all kinds of efforts from government and NGO?
The new technology, are they meaning new technology?
Yeah. What kind of new age technology? I mean, technology that can be used to reach out to children who remain unreached in spite of NGOs. And I think they're talking of the far to reach places.
Yeah, I think they've answered the question. Because I don't think they can be reached so easily. in terms of the new age technology. I think these are the people, children who are in the wrong terrains, hilly areas, they will not be reached. Okay, unless the government steps in to have everywhere internet, all that. But I think more than that, what we need to do is map these areas, and let's not say in spite of NGOs. I think the government, it's the government's responsibility to reach them, and as the NGOs, we will supplement their efforts.
Thank you. So there are a few more questions but we'll send it to you because of time. Now the next question is for Eliana, in which the thing is that how does one ensure street children and education in this pandemic? Because it's a both thing of education and protection for street children.
Well, this is a tough question, and definitely I don't think I've got an answer for it. And I challenge anybody to have an answer for it. What we can say is just what has been our experience for many years. We're talking of a group that has never gone to school. And even when you get them into programs, it's very difficult to start an education programs because they are just a highly mobile group and probably the most deprived group, one of the most deprived. So I think from my perspective, I think the answer is go out of the rigidity as we have it now and move to a range of opportunities. I think we need to, like we have done in health, for example, in the health sector. You start from, you know, the prevention model to the PHC, high to hospital, high to high specialty. In education, as it was also underlined by me, by other speakers before, we do need a structure. We need schools, but we need schools also to be supported by other education opportunities. And between the school and the community, or we can go down further to the street and beyond, we may need to come up with a number of solutions. The COVID situation is forcing us now to do it. We have known it all along, but these groups were not a priority. Now, the well-to-do groups are in the same situation. So maybe that is the chance now to look at schooling in a more, or education, which is a word I prefer, in a more flexible way, and in a way that is more situation appropriate, more, you know, appropriate to the groups that we are addressing, because we said that all of us, education is not just schooling, it goes much, much, much beyond. So the emergency can become an opportunity. I think India, from among the different countries I worked in the course of my life, I think is one of the most creative and definitely one of the richest countries in terms of experiences on the ground. We heard people who have been working for 30 years, 20 years, half a century, like CINI. So I think the time has come to consolidate these experiences and turn them from alternative civil society alternatives into mainstream for an education system that becomes more flexible. If you look abroad, the most advanced education systems are much more flexible. Okay, so that is the direction for India also, if you ask me.
Can I just add here? Can I just add here that there have been experiments and there have been experiences around us.
Farida.
There are some experiences around us, like Women Pratham has done, that we do work with children on the street and children in institutional care. And as Elena said just now, that the school has to be flexible so that it opens its doors to these children, because otherwise we'll get into this second non-formal kind of education, which is not allowed for under the fundamental right to education. But one could look, there are schemes whereby you train these children, acclimatize them to school, and then bring them back to school. But the curriculum, teacher, there have to be pillars to support these children so that they are sustained.
Absolutely.
So and I can share this. I can send you some experiments which we have done.
Please, for our learning also, Farida. Thank you so much.
Yeah.
Thank you. So, Srija, you wanted a question? Unmute yourself, please.
Yes. I actually wanted to ask the question only that how may we ensure the education of street children? That was my question, because it's been 2 years and the schools are closed. The ICDS centers we are talking about, that is also closed. So how may we ensure the education of street children who might not have eaten food properly, who are living in the street? So, but education is also needed. So how may we ensure that?
Yeah, okay. So Srija, this was partly answered by both Farida and Eliana. So good, you've got your answer. So there is a question for Bharti ji, in which it is like, what are the components one should keep in mind while designing education protection programs for these vulnerable children? I think you all did share, but you can say it again. Yeah.
No, I'd just like to again insist on the fact that, particularly vulnerable children are those who are on the move. And how do we bring them to the education system or bring the education system to them? That's a huge challenge. And therefore, I feel that technology can play a role in connecting them to the education system. But it means investing in pedagogy, content, curriculum. A whole new set of education materials need to be developed for reaching out to these children. And as Farida ji's already answered, she said that, we need to have these mechanisms that can ensure that they're able to meet up to the levels where they should be and then connect to the formal education system. So that requires a lot of work.
Yeah, thank you very much. And though there are more questions, but the time is time is limited, and I will just take 3 minutes to summarize some of the things that have come up, which are very important. Firstly, thank you very much. And I hope CINI had organized the whole day discussion, because there's so much more to learn from each one of you. Anyway, just a couple of things I want to summarize. One is saying that this is a time for education emergency. This is a time for child protection emergency. There's also another thing highlighted, that there was already a poor learning, which has now been enhanced because of the COVID. And so the importance of investing in this, the role of parents, the role of teachers has come up very strongly. Things like radio program, mentors in the community, the importance of introducing digital literacy in schools, which has also come up. The other vulnerable group which needs a lot of thought is the children of COVID affected children who have single parents or have become orphans, and how we can link them to the present social protection schemes. There are several in the country. I mean, that has to be extended. Community level, again and again, I think everybody insisted on the importance of community level interventions. And finally, investing in micro and macro research, which will highlight the gender divide that has come up, and advocacy, which will make our advocacy stronger for that. The role of technology being very important. And finally, I would say collaboration, coordination, and working together as what we all have to do, because it is a very important issue, and children, we always know best interest of the child. Finally, I would finish by saying that in any pandemic, I hope the pandemic finishes now, but the school should be the last to close and the first to open, because of this, all kind of issues have been created. Thank you very much. And thank you very much, all my panelists. You'll have been very good and time. And over to Lopa.
Thank you for chairing the session so well.
Thank you, Sulagna Di, and to all the esteemed panelists for their inputs. It is now time to welcome and recognize CINI's friends across the world who have been persistently supporting us through their relentless efforts to raise funds and help the vulnerable mother and child through the pandemic and the natural calamities that they have faced. For this, may I now invite Dr. Riggio to welcome CINI's friends. Over to you, Dr. Eliana Riggio.
Thank you, Lopa. I've been asked to take this session, though I believe this should have really been handled by Dr. Shamir Chowdhury, because he has been the man behind, all of us around the world coming together to support CINI over the last so many years. But since I'm in Calcutta, he requested me, since I'm also part of this small movement that has grown around CINI, to take this session on his behalf. So I'm very pleased to do that, of course. And I think I would like to start by, again, thanking Shomir for having been traveling around the world from east to west, supporting all these groups that have been created in different countries of the world to support CINI over the years. First of all, I can see that all of you are connected. And I know that some of you just woke up, some of you are going to sleep. Since we are embracing the entire globe, and we from India, from Calcutta, we are sort of in the middle. So I can see Jenny, I can see Ross, I can see Mark, I can see everybody. It's fantastic. Wonderful to see everybody here. And to get the sense that CINI is in the community, CINI is in India, CINI is right here in Poland today, but is also in so many other parts of the world. So let me go through my notes that Shomir has prepared, but he has refused to now present today, but I'll do it very happily on his behalf. So what he has reminded all of us is that it all started with Margie, whom I hope she's also connecting with us at some stage. Mrs. Margaret Stephen from Glasgow, and Ross is there from Glasgow with us today. And Margie, with Shomir, two nutritionists, started this great idea. That was the early 70s when Margie came to CINI, when it was just the beginning of all the work down here in Poland. And as a nutritionist, she immediately clicked with Dr. Chaudhary because, you know, she could see how with simple solutions, the huge problem, complex problem of solution, problem of nutrition could be addressed. So she was quite enthused to see that things could happen with so little. And she went back to UK with, of course, resources are of a different nature, and she got other people involved within her own group in Glasgow and, you know, at the national level in the UK. So that is how Friends of CINI Glasgow started, or Scotland started long ago. Then maybe Ross will give us the date later on. And how it continued to this day through a group that has been extremely active and very close to CINI. Then after that, there has been another group being created, and that was in 1990, and that was CINI Italy. CINI Italy is the second group. I'll speak about CINI Italy later in a different incarnation, but right now I can say that we are crossing 30 years this year in 2022. So we are very happy for a journey that has also involved us for so long. Then a third group that came up very important is Friends of CINI USA, which was registered in 2003 in the US, and it has been actively supporting CINI with the participations of different friends and colleagues. I think Mark is there with us, and in fact, I'm so happy now you're turning on all your videos. So now I can see all your faces, and I know where you are sitting in different situations, because I've had the privilege of coming and visiting most of you over the years, along with Shomir. So, CINI USA is another important group we have, and has been with us for a long, long time. Last but not least, Jenny, who is watching us from Perth, and she registered, she has been active, she has been associated with CINI for decades, since she was a student, a medical student, but then being a very busy person, despite being a busy person, at some point in her life, she also thought it would be a good idea to float CINI Australia. And she's been one of the most active friends of CINI, mobilizing money, people, and lots of goodwill around this type of work. And she was able to come on board technically, I would say formally, institutionally in 2010, but she has been associated with CINI herself, her family, her brother and friends for such a long time. Last but not the least is CINI Switzerland, which doesn't exist. So don't take it as an announcement because it doesn't exist yet. But Furio Bednaz is with us today. Hi, Furio, from Italy and from Lugano, actually. And he is planning to register and is very, very active already in getting CINI to known across Switzerland. a small place, but full of money, as we all know, and is very much interested in floating CINI as an organization during this coming year. So welcome for you to our family, and we look forward to having with you in the coming years. During the years, we had also CINI Belgium. We also had CINI Holland, which contributed for many, many years. And now these friends and colleagues are still connected with us, maybe not as much active as before, but they've been great contributors. And I think also Martin is involved in this conversation. Maybe he's waking up a bit later, so he will see us through YouTube a bit later. So this is our family. And the wonderful thing that CINI is saying that fills up my heart with happiness is that at the time when there is a risk of losing other donors, when money for development and for poverty is shrinking all over the world. We just heard about the new Indian budget coming out for India, for children of India, which are, in this country, is not our countries. Here, they are 40% of the population, but 2% of the money is dedicated to them. So our groups, in our small way, can make a difference. And we are not only about money. We are about the good news of CINI. What CINI has to tell the world. What are the innovations that take place on a terrain that can be very challenging at times, even at the time of COVID. So one important thing is that during COVID time, our little groups, CINI is telling me, and I'm taking that as a great compliment, we have given a sort of a backbone of funding when it was very much needed. And as we are their family, as we are part of the family, we don't ask too many questions because we know exactly how fantastically and how transparently the money is used. So I would like to thank all of you on behalf of CINI, since I've been given this privilege to do that. And also, but more important, I would like to thank all the colleagues in CINI who have kept promoting our programs, implementing the programs that we have been bringing in from USA, from Australia, from UK, from Italy, from all over the place, under almost impossible circumstances when it was so dangerous to go out in the field. And they were there, and none of our programs have really suffered, even at times when we ourselves were locked in our homes because we were scared to go out in the streets, but our colleagues were out there in the field. So thank you to all of you. And it's very, very nice to be here today. It is a limitation for us to be having a celebration like this online, but it's also a wonderful opportunity because for the first time, we can see the spread of the operations of CINI across different regions of India, in South Asia, and in other regions of the world. So I think now we will go down in chronological order and we will be told how to present our work in different countries of the world. Lopa, over to you again.
Thank you, Eliana. May I now request Mrs. Rosalind Jarvis from Glasgow, UK, to kindly share a few words.
Good morning, or good afternoon, or good evening, and greetings from a cold and windy Scotland. Can you live stream some warm sunshine to us, please? It's a great privilege to be part of the CINI family and to have witnessed it growing from strength to strength over the years, rising to so many challenges, COVID, of course, being the greatest of them all, and establishing such a vital, enduring place in the fabric of India. In the UK, we continue to make our modest contribution. And despite the continuing restrictions related to COVID, we had another good year in 2021, thanks to the energetic and well-focused efforts of our fundraiser, Freya Marshall, who enabled us to raise almost £200,000 or 20 million rupees for CINI, well over 10,000 pounds or £1 million rupees more than the previous year. The bulk of this comprised almost £48,000 in response to COVID and Amphan appeals, almost £15,000 for the tea gardens, £10,000 for the Rambagan project in Kolkata, £7,000 for girls' education, and £5,500 for Sponsor a Mother. When our support group was established in the 80s, almost all our income came from individual supporters and small trusts which our supporters were connected with. And these individuals remain a significant source of funds and networking. Now, though, Freya does the bulk of her fundraising through trusts and foundations with whom she's building long-term relationships. Although COVID and Amphan attracted extraordinary support over the last couple of years, the downside is that the ongoing work of CINI attracted less as a result. Nevertheless, the corporate partnership with Ahmed Tea has enabled significant work to be done in Guri and Assam in the tea gardens, and we hope that this will just be the start of other partnerships to follow. Now, a request. CINI and the UK greatly benefits from Indian expats who are keen to help where there's a need being addressed in their fatherland. But our knowledge of these individuals depends almost entirely on personal contacts which are passed to us and to Freya in particular. So if you have any knowledge of Indians, and in particular West Bengalis living in the UK, who might be persuaded to contribute to CINI's work, please let us know, and Freya will follow this up. And finally, 2 words of thanks. Vital to Freya's success is the information provided to her by CINI in India, because without this information, she cannot persuade people to give. So in particular, we'd like to thank Kalkali and her many colleagues in the field where the work is being done. You are a vital part of this success story. And here in the UK, we owe an immense debt of gratitude to an anonymous donor of a painting, which was auctioned in November and which raised almost £300,000 or 30 million rupees for CINI. Thank you, and we wish you all very well in your endeavors.
Thank you so very much, Mrs. Jarvis. And we shall definitely let you know about the Indians who live in the UK and are from West Bengal or are from the intervention states where CINI works. We shall definitely let you know, ma'am.
Thank you.
Moving on, may I now request Dr. Eliana Riggio. Well, we've written over here from Verona, Italy, but she's very much in Kolkata with us to share a few words. Over to you, Eliana.
Thank you, Rupa. I'll be quick. You have heard enough from me today. I'll try to be short, but I need to do justice, otherwise my CINI Italy team will not like it. So CINI Italy has been very busy this year, and it has been, as you know, a terrible year for my own country this year in terms of COVID. It has been one of the worst hit countries. Despite that, contrary to what Ross had to report about the situation in the UK, we were lucky. We were able to raise more money than the previous years. We have, in fact, ensured the same achievement of over 400,000 euros. But we also got a special donation, sort of anonymous, that I cannot comment much about, of about 200,000. So we are above 600,000 euros. So that is we are quite satisfied with the achievement of this year. But as I said before, part of our work and what we believe in also is also to promote what CINI is all about, because we think CINI has a lot to say in terms of how to reach out to children in a way that would make a lot of sense also in our own different contexts where we live. So we do this, our work is really on the two fronts, fundraising, of course, and but also what I call development education or education on the rest of the world, and also technical inputs. I mean, solid technical inputs that we develop here in the R&D groups here, and we experiment in the field that could be used very much in Europe. And when I meet counterparts, sometimes they say, my God, this is so advanced. We'll need some of this also in our own context over here. So our work has been on these two fronts for the last 1 year. We have institutional projects, mostly with foundations. Italian government doesn't have much money for India or for development in general. So our counterparts are mostly foundations, family foundations, bank foundations, business foundations, with which we have had a relationship for many years. Some of them have come to India, they've seen the projects here, and we have been able to establish that ground for ourselves. Parallel to that, we have individuals. Individuals who are, some of them, people who give you 10 rupees, 10 euros a month, but regularly. So that's a nice backbone. And then we have what we call great donors or major donors, larger donors, who are individuals, but who insure large sums of money on a regular basis. So these are the type of profiling that we have. And this year we crossed 700 donations. So we have created a base for ourselves, which is pretty encouraging in terms of our work. We also run sponsorship projects, mostly 1,000 days, but also education programs, where through distant adoption sponsorship, an Italian donor can support one child back in India over a number of years. I must say that during the COVID time, some of our traditional donors have given us a second donation for COVID. So we have been able to go back to the program areas where we already are implementing projects, not we, but our colleagues in India, of course, and add a layer, as they say here in India, of COVID intervention. So we've been able to, we have tried to keep the communities healthy in order also to better implement education, nutrition, health, and child protection. So that's how we work in Italy. We work extensively online. Online contacts are very important. In the last year, they've been vital because we have been out in the streets less in our country. We have been more online, but we are extremely active online. And we work to a work plan on a yearly basis to reach out to all people that are already with us and hopefully new people. And we have been recognized also by the Italian government. We have been a recipient of a very prestigious award by the Parliament of Italy. Not we, CINI Italy, but CINI India has been. And that has been a good recognition, which has also allowed us to access fiscal programs of the government, whereby donations and also donors who get in contact with us and support us can get some rebate from a fiscal point of view. So that's also very helpful. So like Ross, I want to thank our CINI colleagues who have been able to keep up the programs and projects in the under the worst possible conditions over the last year. I want to thank my GB, my board, my wonderful team, our wonderful team back in Italy, Monica, Cecilia, Sarah, and but more above all of them and all of you, I want to thank the CINI colleagues who have been able to really implement under these very, very difficult circumstances. So thank you for giving CINI Italy a chance to speak, and back to you, Lupa, again.
Thank you, Eliana. Thank you so very much for your continued support, and definitely where you spoke about supporting our children in the institutions, because we know that the government is investing less and less, and we just got to know from that budget part. And thank you for all the sponsorship and for all the adoptions. Thank you so much. Moving on, we move on to CINI USA. And may I request Mr. Mark Sherman from Boulder, Colorado, USA, to share a few words.
Oh boy, can you hear me okay? I hope. Yes, okay. Well, it's early in the morning here. It's 1:45, and I'm more than glad to get up for this because this is a big deal. And we had a good year here in the US, probably our best year since I was asked by Dr. Chowdhury to take over CINI USA 10 years ago, I think. So I have a daughter who's adopted from India at the age of 5 months, 21 years ago. And she now goes to school in Sarasota, Florida, and has a year and a half left of that. I don't know, other than it being a better year than any other year of the 10 I've been involved, plus the gigantic donation from Mackenzie that we all get to share in, and is a godsend. I'm just here to help funnel money to the folks that know what to do and how to do it, which is CINI India and Dr. Chowdhury and all those soldiers on the ground who are doing the heavy lifting. I'm just here kind of funneling the money when I can. And I don't really have much else I can add unless anyone has a question or comment or something. It feels like I'm looking down at the bottom of the screen because the camera's up here. I'm not looking at anyone in their eyes, and I don't like this. But if I look up at the camera, then I can't see your faces. So this is a weird situation. So know that when I'm looking down, that's really only because I want to see your faces, not because I'm hiding. So thank you, Dr. Chowdhury and CINI India, for all the work you do.
Thank you, Mark. 2 a.m. in the morning. Well,
yes.
It's really tough, I know. But thank you for all your commitment and being with us in this day-to-day. I move on and we move on to CINI Australia. And may I request Dr. Jenny Connaughton from Perth, Australia. Over to you, Jenny.
Hi, everybody. It's wonderful to be a part of this Foundation Day again. And first of all, the first thing I have to say is congratulations to Child in Need Institute for what you've done for 48 years, but particularly what you've continued to achieve through this COVID pandemic. Every time I hear news from India and I get a report from some of the programs that we're supporting, I'm absolutely inspired by the commitment and courage and bravery of all those people on the ground who are continuing to deliver COVID assistance kits to families and children, who are running the COVID assistance centres, who are going around in the tuk-tuks into the slums and the hard-to-reach areas to make sure that the message gets out, and the extraordinary impact that you've had on the government vaccination drives and your commitment. The other thing that I always get out of Foundation Day is the panel discussion and the continual commitment to keeping thinking about how best to address the issues that are facing the children and women in India. And I love that part of the day. It always stretches my brain and it always awakens my hope that CINI has been a great source of for me for 48 years. And Shamir and Eliana, it's great to see you sort of in person. Indrani, Obinash, Lopa, I can't see everybody else. And it's also wonderful to see the international group, because as an individual out here in Australia, it's helpful to know what everybody else is doing. And it reminds me of the capacity of people to give if you just stand in front of them and tell them the amazing story of CINI. And I know that there are a lot of other people who are watching, and hello. In the last few years, we've continued to support the child-friendly communities in Uttar Dinajpur, which is, they have done a fantastic job. They are a fantastic unit. The HR program across the 3 districts do a very special job for children living with HIV. This year, we've had the good fortune to participate in the urban program, Ujan, for at the adolescent program in the red light district. And for the first time ever this year, we received West Australian government funds, and that went to a COVID relief project in Assam. And that was only a 3-month officially, but we stretched it out to 5 months, a fantastic program implemented by the Assam team, and really reflected all of CINI's principles. So I'm sure there's other things that I wish that I will have said, but my main message is thank you to the team in Australia that help us achieve what we're achieving. I think this year we made about $350,000, which was a step up for us. And there was one woman who left us a whole lot of money in her will, and she was just a generous individual friend of my mother who supported us forever. And I always think you never quite know which corner the money will come from. And I really value telling the story of CINI. So thank you for letting us be a part of this astounding organisation. Thank you for keeping our minds and our hopes awake. I'm honoured to be a part of it. Namaskar.
Thank you, Jenny. Namaskar from our end as well. And thank you for your continued support in the state of West Bengal and even going beyond in Assam. Thank you once again. Maybe now go to Switzerland. And for this, may I request Dr. Fiorio Bertnas Lugano to say a few words. Over to you, sir.
Thanks a lot. It's really, I'm totally new in this group, of course, because we have a project now, and we are trying to set up and to develop this project. But it's really a great pleasure and an honor for me to participate, to join this 48th celebration day of CINI. Because really, I knew CINI about 4 or 5 years ago, just reading, just discussing with Eliana, with Shomir. And since I knew CINI, I've been fascinated really by the method, the CINI method, the approach that they have, and how they integrate things, and they make this community-based work that is very important. And also, I was fascinated by the links they established between education and training and protecting the child, the mother, and so on. I think it's a very interesting lesson also for us, also for the work we are doing in our countries. So what I learned a lot also today, because I have had the opportunity to know since the field work you are doing in India, and it's absolutely astonishing. It's really a very important lesson to me. We are trying to develop a project in Switzerland. Switzerland is a very small country, of course, is a rich country, of course, you know also that, but at the same time is a country traditionally engaged in cooperation in different ways, of course, collecting money. We have many foundations here, private foundation, company foundations, bank foundations that collect money and also provide funding. But also the Swiss Confederation is very active in the field of cooperation. They have a strategy. They also developed for 10 years a big governmental program to foster dual apprenticeship model in professional training, vocational training in India. And it's something that, of course, from the formal way of cooperation is very important, is complementary to other things that we can do. I worked all my life in this field of vocational training, job market and guidance and so on. So it's the word I visited in all my life. Of course, the idea is to create this association, a supporting association for cooperation in Switzerland, both for fundraising, but also for mutual learning, we can say. So to develop common projects. This is the idea that we have. Also because normally collecting money in Switzerland means find a project and finance this project with evidences of how it works, where the money has been left, and how it works. So it means that common projects are the way in which normally we cooperate with other countries. And thanks to the fundamental support of Shamir and Eliana, we already met some people in Switzerland to create the basis for this association. And it's a promising first step, of course. The idea is to create the association now and then to spread the information of the associations and create a good membership for the association. So it means not only a couple of people. Of course, it is juridically possible to create an association with 2 people, but it makes less sense. Of course, we have to create a network, a good membership, and networking is the first things to do with stakeholders and so on. Moving from our region in Italian-speaking part of Switzerland, also with the support of CINI Italy that can provide us with very strong help in these phases, and then to begin to imagine a couple of projects in which develop this kind of work. So we are here, of course, to help CINI, but at the same time to learn something and to have this kind of mutual learning experience. I'm really very, very glad to join the international community of CINI, of course, to know one each other, maybe, hopefully in the next future, also meeting face to face. And thanks once again.
Thank you, sir. All the way from Lugano, Switzerland, and best of luck for the network, which you just mentioned now. We have now reached the last leg of the program, but it will remain incomplete if you do not hear words from our Chief Executive Officer, Dr. Indrani Bhattacharya, lovingly known to many of us as Dear Indrani Di. So requesting Indrani Di to share a few words, give her vote of thanks and conclude the program.
Good afternoon, everyone. It's an honor for me to offer the vote of thanks on the auspicious occasion of 48th Foundation Day of CINI. On behalf of the entire CINI family, I am thankful to all who are here with us, both online and offline, to grace the occasion, as well as to all of them who couldn't join today, but supporting us relentlessly to serve children, adolescents, and women in India. We want to give our special thanks to the Honorable Chief Guest, Sri DILIP MONDAL Sir, Minister of State, Department of Transport, Government of West Bengal, who despite his extremely busy schedule, was able to join us to celebrate the day and share his valuable speech. We have been fortunate to hear from our special guest, respected Srimati Ananya Chakraborty Chatterjee Madam, Chairperson, West Bengal Commission for Protection of Child Rights. On our experience to protect vulnerable children in West Bengal, we are thankful to you, Madam, for your distinguished address to the audience. I want to extend my generous thanks to Srimati Madhuri Bose, founder, Bose Legacy Foundation, and Dr. Anita Sheth from Johns Hopkins Bloomberg School of Public Health for gracing the occasion as special guests and for their motivating words on the partnership with CINI. They have also shared their contribution to the development of children and women in India. Further, our big thanks goes to Sri Avijit Mitra, Special Secretary, Department of Women and Child Development and Social Welfare, Government of West Bengal, who in all these years has continuously contributed towards the empowerment of adolescent girls in West Bengal and in protecting the rights of children, adolescents, and women to secure their nutrition. Thank you, sir, for being with us in the panel discussion. My sincere thanks to other esteemed speakers in the panel, like Dr. Eliana Riggio, President CINI Italy and advisor to CINI, Srimati Farida Lambay, co-founder Pratham, Srimati Rema Mohan, Chief Executive Officer, National Stock Exchange Foundation, Sri Ranjan Kanti Mohanty, Chairperson, National Action Coordination Group India to End Violence Against Children, and Srimati Bharti Ali, co-founder of Hawk Center for Child Rights. All of them shared their valuable thoughts, insights, and experience, which will guide us towards the future directions and will help to address the issues of child education and protection affected by the current COVID-19 pandemic. Thank you, Srimati Sulagna Rai, CINI GB member, for her beautifully moderation of the session. I want to extend my generous thanks to the friends from CINI international groups around the world. Despite their presence in different time zones, they joined the ceremony and shared their valuable thoughts on how they are supporting CINI to ensure our work with the vulnerable population in different parts of India. We have been fortunate to have renowned persons with us from government, international NGOs, UN organizations, corporates, and foundations, partner NGOs, academics and other support groups, friends and well-wishers around the world. And I am extending my sincere thanks to all of them. I am very much thankful to government and other donors of CINI who have shown their faith in us. Without whose support, we could not see the light of 48 years. I want to give special thanks to our governing body members who are providing us constant policy guidance and directions. A special mention to our founder secretary, Dr. Samir Chaudhuri, who being the catalyst is continuously inspiring us to do our best and stands as a pillar of support to reach the most vulnerable and unreached children in villages and slums. And also, we are very much grateful to other governing body members of CINI. I would like to thank our children from the Kolkata slums who started the day with the beautiful dance performance, and also to all the children, adolescents, and women who are the change makers in their own community and show us the way to best serve them. Last but not the least, I want to thank my colleagues who worked behind the scene to execute this event. Quite a few of them, though down with COVID pandemic 2 weeks back, organized the ceremony with great passion and love. Thanks to the technical arrangement team, Anuj Enterprise, the editing team, and the housekeeping staff. It's not possible to thank everyone by name, but we are thankful to all for such an appreciating involvement throughout the day. Please forgive me if I missed anyone. Please forgive us for the technical glitches in the sessions, during the sessions. And also please forgive us if we have done any mistake unknowingly. We are learning. We will try our best next time.
Indrani, you should thank
So friends and colleagues,
Banerjee.
Our journey towards CINI at 50 starts from here. And I hope that all of you will be with us to celebrate the day. Before ending, we would like to share an inspiring story of our friend, the story of Dhanmoni Bora, the first lady Toto driver of Assam, and how she is, with support from CINI, leading the charge to get all the underprivileged population vaccinated in urban pockets of Guwahati. She's an inspiration for all of us. So again, thank you all of you for being with us throughout the day. We'll end the session with a short video of Dhanmoni Bora. Thank you again.
Sun is yet to peep out on top of the Kamrup hills. The water of Brahmaputra river is still misty. The ancient temple city of northeastern India is waiting for another day. While in a bylane of Guwahati, a woman is engaged to prepare herself for another battle. Dhanmoni Bohra is a three-wheeler driver of Guwahati city, is a single mother.
When boats travel up down the stream, listen to
She has two adolescent kids and an extended family, the whole city to look after.
glass windows of both the houses glittered like gold there, so the golden windows were visible at sunset.
Dhanmoni would have to rush now.
Dhanmoni is an example of women empowerment. She herself is a survivor of domestic violence. So if a woman who is a survivor of the domestic violence can fight their life and she is earning, she is managing her day-to-day life, she is also a single mother there. So in Assam, not only in Assam, in India, if we set an example, if we come across such change maker, or you can come out as an ambassador of women empowerment, the women in the community are relating to the Dhanmoni.
Corona virus or para kabodhan bhai. Corona virus or para kabodhan bhai.
During COVID pandemic, when the whole world went into a shell, Dhanmoni Bohra was among the few exceptions who reached out for others. She had nothing but a tuk-tuk or three-wheeler to offer. When Child in Need Institute, CINI, an Indian NGO, offered her to convert her three-wheeler as a mobile COVID Sahayata Kendra, CSK, or COVID utility vehicle, she did not hesitate.
তো 18 বছৰ মোৰ জীৱনটোৰ লগত মানে যুদ্ধ কৰিছো যেতিয়াৰ পৰাই জানা হৈছো তেতিয়াৰ পৰাই মানে জীৱনটোৰ লগতে মানে খেলি আছো তো কৰোনাৰ লগত তো 18 মাহে হৈছে তো চাও পাৰো নে নোৱাৰো তো সমাজক মানে কেনেকে আগুৱাই নিব পাৰো মানে কেনেকে যুজিব পাৰো এইটোই কেনেকে আমি বেমাৰটোৰ পৰা বাচিব পাৰো তো বাচ্চা আছে ঘৰত মানে সাৱধান থাকো দিনটোত 200-300 কোনবা দিনা বহুত মানুহ হৈ যায় ভয় কৰিলেতো নহব তো আমিতো আগুৱাই যাব লাগিব সবে যদি ভয় কৰে কেনেকা হ'ব আৰু কিছুমানে মানে ভুল ধাৰণা কিছুমান আছে মানুহৰ যে আমি এতিয়াও মানে ভ্যাকচিনটো ল'ব নালাগে বুলি তেওঁলোকক বুজাব লাগে হেল্প কৰিব লাগে মেডিকেল যাব লাগে তো আশা বাইদেউ এনএমএম বাইদেউক ল'ব লাগে মেডিচিন ল'ব লাগে তাৰ পিছত আৰু মানে যাব লাগে আৰু কিছুমান বেমাৰী মানুহ থাকে মানে যিবিলাক আহিব নোৱাৰে তেওঁলোকক হেল্প কৰিব লাগে আপুনি ভ্যাকচিনটোৰ পৰা কোনো ভয় খাব নালাগে মানে ভ্যাকচিনটো ল'ব লাগে আমি আমাৰ মানে সেফটিৰ কাৰণে দিছে কৰোনাৰ পৰা মানে আমি বাচি থাকিবৰ কাৰণে দিছে সামাজিক দূৰত্ব বজাই চলিব মাস্ক পিন্ধিব
ধনমণি যদি আজি হৈ পেলাই যদি পুৰুষ হ'লহেঁতেন তেনেহ'লে আমাৰ তেওঁৰ লগত অলপ বহি যোৱা বা হেৰি কৰি যোৱা অলপ অসুবিধা হ'লহেঁতেন কিন্তু ধনমণি হোৱাৰ কাৰণে তেওঁৰ লগতে সন্মুখতে লগালগিকৈ বহি ধনমণি মই আৰু আমাৰ NM বাইদেউ মিলি ঘৰে ঘৰে হেৰি কৰি ঘৰে ঘৰে গৈ আছো আৰু প্ৰত্যেকৰ ঘৰে ঘৰে গৈ আমি তেওঁলোকক সজাগ কৰিছো।
It is not only driving the mobile CSK. Dhanmani volunteers in every work possible. She helps people at CINI's COVID Sahayata Kendra at Central State Dispensary area of Guwahati. You will find her at various vaccination centers, helping people by booking vaccine slots through mobile phone and with so many things.
Dhanmani Capital State Dispensary karone মোৰ দৃষ্টিত বহুতখিনি কাম কৰিছে তাই নিজৰ ঘৰত বাচ্চা দুটাৰ বেমাৰ হোৱা সত্ত্বেও তাই কোনোদিন এবসেন্ট থকা নাছিল। তাই ৰাতিপুৱাই আহি মোৰ পৰা ইনফৰমেশ্যন মই য'তে পঠাওঁ তাই তাতে যায়। গোটেই তাইৰ कामखिनि যথেষ্ট শলাগ ল'বলগীয়া আৰু যথেষ্ট প্ৰশংসনীয়।
धनमनी और उसके बच्चे के लिए एक जोरदार तालियां। और हम चाहते हैं कि धनमनी आप अच्छे रहे। आज धनमनी तो वो टोटो खड़ा है, हमारे साथ काम करते हैं, वो टोटो लेके पूरा गुवाहाटी में घूमते रहते हैं, वैक्सीनेशन करते हैं हमारा ANM बाइडो के साथ। धनमनी को थोड़ा सा हम लोग फेलिसिटेट करेंगे, बेटी माँ को करेंगे, इससे बड़ा कुछ हो नहीं सकता है।
প্ৰতিজনী মাইকী মানুহৰে সপোন থাকে যে নিজৰ বাচ্চাক কিবা এটা মানে কৰিব, চবৰে আশা থাকে। মানে ভাবিছো এতিয়া পঢ়াব নোৱাৰো, স্কুল পইচা দিব নোৱাৰো, এতিয়া কি কৰিম। তাৰ মানে এনেকুৱা মানে সময় আহে যে স্কুলত পইচা বিচাৰি থাকে, মই মানে সৰুৰ পৰা দিব নোৱাৰো। এইটো নকলেও মোৰ উপায় নাই, মইতো লৈছো তেতিয়া চলাবই লাগিব। মানে পইচা পাতি ঠিকে মই মানে লাহে লাহে অলপমান ভাল হ'ব ধৰিলে আৰু তেনেকে তাৰপিছত মই NGOটোত সোমোৱাৰ পৰা মোৰ অলপ বেছি মানে এইটো চিন্তাটো অলপ গুচি গৈছে আৰু আপোনালোকক এনেকে অলপ সহায় কৰিব পাৰিছো NGOৰ ফালৰ পৰা, সেইখিনিয়ে আৰু।
Dhanmani is the name of a resurrection, converting her struggle for a bigger cause. At the toughest time of the human civilization, people like Dhanmani Bohra have come forward, simply inspired by the joy within.